Recording in progress.
Доброе утро, коллеги.
Good morning, colleagues. I see that today the room is not full, but I hope that the colleagues will join us. I would like to welcome you the second day of the international conference. Yesterday, the presentations were made about the course of the project within 3 years of its implementation, and now we are going to have a practical discussion. Let's talk about your expectations of all the institutions on different levels. The morning session before the coffee break includes 4 presentations. After each speech, if you have questions, please ask these questions. Although we are young, after the second or third presentation, we forgot completely on what we wanted to ask. So today's session, the morning session, will be moderated by me and my colleague Aizat. Good morning, I was afraid not to mention it correctly. This is from Shymkent, South Kazakhstan Medical Academy. We are working closely, and although the weather is not that good, I hope Shymkent will bring some sunshine into our days.
First presentation, Paolo and Feruza. You are ready? Yes. Yeah? Okay.
Доброе утро, коллеги.
Good morning, colleagues. Could you please put our presentation on the screen? Today, my colleague Paolo and I are going to tell you about the GBI evidence implementation, which is one of the GBI Center objectives. GBI Center will be implementing projects, and this is the information we're going to present. It's very topical for practical healthcare, so colleagues, please take this into account. You can see GBI model for evidence-based healthcare. Focus on the center of this model, and I hope that you can see this. The evidence we are using in practice should have some particular features, such as achievable, significant, measurable, efficient. This scheme covers all the aspects which should be used for us to be sure that the healthcare in Kazakhstan is evidence-based. This model has the circle form, and it is a cyclic process, and all the stages are linked with each other. Taking into account that the main objective of evidence-based healthcare is global healthcare, but in order to achieve this, we need to gather evidence, to be able to find research, to carry out expert evaluation, to compile or aggregate data we get through systematic reviews, development of guidelines. Then we should be able to transfer those evidences into education, into practice, and introduce actual data into the work of practitioners. And this is an integral part of the global evidence-based healthcare. Today, we are going to talk about that orange part, which is the introduction of evidence data, factual data, for our practice to be evidence-based. The projects of implementation using GBI methodology include 7 phases. You can see them on the slide. And the next slides, we're going to tell you in details about these phases. I know that this is the second day of the conference, and it's very hard to sit here and listen to us for such a long time. So there are 7 of them. We define the scope of the problem, then we identify the stakeholders. These projects are carried out jointly with the clinical practice professionals. Then we define the group of individuals and indicators we are going to use. Then we assess the readiness. As we carry out the readiness assessment, we told you about it yesterday. Number 4, we carry out the practice review based upon criteria. The phase number 4 is the audit. Phase number 4 is introducing amendments or changes using GRIP methodology. We propose and introduce changes into the current practice for it to be evidence-based. 6th phase is the repeated audit, and after the implementation, number 7 is ensuring sustainability of these novelties we've started to introduce at stage 5. So this is the evidence implementation. This is what was in the previous model. We're going to consider this today, and we are going to have this slide about what evidence implementation is. Let me skip this slide as everything is on the screen. And I would like to give the floor to Paolo, and he will tell you about the 7 stages in more details. Paolo Colette, Assistant Professor, School of Medicine at Nazarbayev University. Thank you.
And today we'll be continuing to discuss or to share with you the process for the evidence implementation. And there are 7 under the JBI approach to evidence implementation. The process or the phases, or phase 1 is about the identification of practice area, which the JBI identified 7 points or where to find practice area. First is the high cost. Second, high frequency. Third, high risk, or known poor processes or outcome that is being used in the clinical setting. Fourth is a topic of local concern. Fifth is the known variability, meaning to say there is unstandardized practice of nurses on a certain procedure in the hospital. 6 is flagged through critical incident review. And 7 is practice area addressed by recent evidence-based guidelines. What I've observed on the literature is that a lot of nurses identify their practice area as a topic of local concern. Just like what we presented yesterday with NROC under implementation of post-surgical pain management. The phase 2 is about engagement of change agent, where individual or groups that undertakes the task of initiating and managing the project. Meaning to say, we are now going to identify who will be part of the implementation project. And they need to be several roles on the project. To name a few, these include system leadership, technical expertise, and day-to-day leadership. Sometimes you may even write the project leader or the co-leader or the internal facilitator or external facilitator. So depending on the roles of your teammates or group mates, then you can have those as your change agents. Phase 3 is about assessing content and readiness to change. This is now where we, the aim of this phase is to understand the issues within the local context using SWOT analysis. And if you remember yesterday, we presented a context analysis that we did at NROC, and we identified several strengths, weaknesses, opportunities, and threats on their context analysis, which will help us to guide our implementation approach of the evidence. The phase 4 is about reviewing of the practice against evidence-based criteria using audit and feedback. We will perform, or we will initially collect the data, analyze the result, and then go back to the clinical setting. We reflect the findings, and then eventually we follow up. But on this phase 4, on phase 4, clinical audit or the audit criteria is based on the practical application of clinical systems.
Что-то очень слышно, как вы переведете. Пожалуйста, люди, которые в онлайне, выключите свои микрофоны, потому что в зале нам плохо слышно презентации. Спасибо.
Okay, thank you. So as I was saying, the evidence-based criteria or standard now need to be identified. So we need to have that one prior to phase 4, during phase 1 or phase 2, because this will guide us to collect our data. Now, the question is, where do we find those evidence-based criteria or standard? One is through the JBI PACES, or the practical application of clinical evidence system. Another is we can find the evidence-based criteria or standards from nursing clinical standards, which we have right now in Kazakhstan. Or we can also find it on the NICE guidelines from the National Institute of Care Excellence. So there are many ways that we can find audit criteria or standards. Then, after we collect the data, we move on to phase 5, and that is to implement changes to practice using getting research into practice framework. Here, we are now going to discuss, reflect the initial findings that we collected from phase 4. We are now going to collect or identify what are the barriers, why we have very low compliance of the evidence. Then, we strategize on how to improve that practice or that evidence. Then, we have to identify the resources and eventually make an outcome on how we are going to measure how the improvement what is the improvement result? How was the improvement measured? On phase 6, so we have already implemented the evidence. Now, we move on to follow-up audit. On the follow-up audit, we are still going to use the evidence that we use on the initial audit. So in quantitative research, this may seem like pre-test or post-test. However, in evidence implementation, especially using the JBI approach, we use the audit feedback. Going back, so on phase 6, this is the reassessment of the practice using the audit or follow-up audit. Now, you might be wondering when or the best time to follow up. There is no consensus when is the best time to do the audit or follow-up. But we have to consider this strategy implemented, how difficult it was, or the staff involvement, and even the culture of the hospital. This is now important with regards to the culture, the context assessment that we did earlier. And then eventually, as we conclude the project, we have to plan the sustainability, which means the ability to maintain and sustain evidence practices beyond the duration of an implementation project. Depending on the compliance rate that we obtain from phase 6, if the compliance of the hospital is less than 50%, then we can do again the audit every 3 months. Or if the compliance is between 50 to 80%, we can do the audit again every 6 months. Or if it's 80 to 100, then we can do every 12 months or annually. That's all. Thank you very much. But before I end or leave this stage, I'd like to, excuse me, I'd like to encourage everyone to, if you have an idea on evidence implementation on your unit or on your area, on different parts of Kazakhstan, please, I do encourage you to approach my colleague Feruza, the director of JBI in Kazakhstan, or Juldus, who is here today, or even the consortium, so that we can work together, collaborate together, and use evidence on our clinical setting. Thank you very much.
Thank you, Paolo. Thank you, Feruza. Имеете какие-то вопросы?
Do you have any questions?
You and for your team, because yeah, it is very important to implement evidence-based practice in our clinical settings. But how you are seeing the main obstacles who are not allowed it for us to implement? Why we are not so fast to fill this gap, theory and knowledge in clinical practice? What you have found when you are reading literature and you are doing your job?
Start. Just
Как вы... Мой вопрос был такой. Мы имеем много хороших...
The same question in Russian. We have a lot of data, but what are the barriers for implementation of evidence-based medicine so quickly, evidence-based nursing into clinical practice? What is the main, so to say, obstacle? You've made your job, you have your own vision, you have a lot of data of other countries. How do you think?
Very much, Aurelia. So my answer would be two. The barrier would be coming from the individual and from the structural or from the management. Now, if the individual lacks the capacity to implement the evidence or doesn't have the knowledge, then we have difficulty on implementing evidence. But what I've observed in Kazakhstan is not the knowledge, but rather the access to the evidence, and then the English barrier. That is why we are here today to help you collaborate with us and then make Kazakhstan stand on the global arena for JBI. Because we are the very first country in Central Asia to be part of the JBI collaboration. Another second answer is that the structural or the management. Even if we have willing clinicians, educators to implement the project or use evidence-based practice in the clinical settings, if we do not have leaders who support us or even who mentor us, then we will not be succeeding on our implementation project.
Thank you, Paolo. And you know, I would like to add more one thing. What you tell, it is also very important our education. What is why we are here, what we are talking about nursing science and nursing education in high level. Without knowledge, without progress, without everyday learning, we can't implement evidence-based practice. You can't have very good structure in the hospital, but if you not ready, you don't have knowledge, you can't do this. Образование самое главное, это все очень...
Education is the most important. Everything is closely linked. Without education, we cannot move further. As you know, the old vehicle will not drive so smoothly with the old wheels. We would like to add, we think that what Paolo has mentioned is very important, but Kazakhstan's peculiarity is that we don't have a lot of master degree specialists in practical healthcare. So our HR capacity is not that strong. We have to increase that cohort of specialists, of practitioners with master's degree, and these are exactly those people who will introduce evidence-based in their practice and will not just use SOPs in their job. So these are the this is the Kazakh setting.
From Nazarbayev University, it is Jonas. Jonas, I am very like to pronounce your name like Jonas because it sounds very Lithuanian, not Jonas. And please present second your presentation.
Hello. Okay. All right. Yeah. Thank you so much. Yeah, Jonas. Thank you. Yeah. Thank you once again, and good morning to everyone. And thank you for attending the second day of this very important conference. We are talking about very important topics about nursing science here, and I am very glad to see, a lot of number of nurses still that we are still attending this conference. All right. So for today, my task is to give you some idea about like. This is not actually a new concept. It has been existing for quite some times in the scientific world. But the recent movement that had been going around in the scientific world sparked again the conversation about this topic, which is your open science. Maybe some of you have heard about it, but we will be talking about more about this one. And after the presentation, I am very willing to answer any of your clarification and question. First and foremost, I want to start my presentation by telling you the outline of the presentation. So first, we will be defining what is open science. We will be discussing the benefits of open science, the key pillars of open science, the values, promoting openness in different levels of the research process, challenges to open science, future of open science, and implication to nursing research. This topic is personally, this topic is very near to me because I am part of the open science movement as being an associate editor of Nursing Open, one of the open access journals of the nursing discipline. All right, so let's start with defining what is open science. So according to the UNESCO recommendation for open science, or on open science, the UNESCO defined open science as an inclusive construct that combines various movements and practices aiming to make multilingual scientific knowledge openly available, accessible, and reusable for everyone, to increase the scientific collaborations and sharing of information for the benefits of science and society, and to open the process of scientific knowledge creation, evaluation, and communication to societal actors beyond the traditional scientific community. In short, from the term itself, open science, it makes science available for everybody, regardless of your color, skin, your nationality, or anywhere you are in the world. It makes science available for you. Now, with open science, everyone, everywhere in the world, discover, read, share, and reuse a published, peer-reviewed research article. And open science applies that principle to the research articles and everything that went into creating it, meaning that includes everything that is involved in the research process, such as the methodology, materials, data, code, and the peer review and publication process, meaning even the editorial decision letters, peer reviews, and author responses to peer reviews can all be made transparently available as part of the scientific record. Now, let's move on. What are now the benefits or the potential benefits of open science to the scientific world and to a greater effect to the society? So open science promotes accuracy of scientific work, meaning open science promote a more accurate verification of scientific results. And that is by combining the tools of science and information technology. Another one, open science is seen to improve ethics in research because like open science reduces duplication in collection, creating, and transferring and reusing of scientific materials. Open science also increases productivity in the era of tight budgets for funding, most especially for nursing because we receive like not a lot of funding opportunities here. Another one is open science result in great innovation potential and increased consumer choice from public research because of the free use of the materials that is already published out there. Open science also promotes citizens' trust to science because it increases participation of the public, because they have already like the accessible or open science make materials accessible to the public, hence improving now the participation of the public to science. Now, let's talk about the different key pillars of open science, and we have actually 4 key pillars of open science. We have the open scientific knowledge, the open scientific infrastructures, open engagement of scientific actors, and open dialogues with the other knowledge system. I will be focusing the discussion on the 2 first key pillars, the open scientific knowledge and the open scientific infrastructures. So when we're talking about the open scientific knowledge, this refers to the open access to your scientific publication, open access to research data, open access to different educational resources, softwares, codes, as well as hardware. So meaning in the model of open science, all of these will become, or is not will become, but it is already part of, you know, the public. So everyone in the public has an open access to these ones. Aside from that, we have also your open science infrastructures, and this referred to the shared research infrastructure, meaning virtual or physical, that are needed to support the open sciences and serve the needs of the different communities. Example of these open science infrastructures are your open labs, your open science platforms, your repositories. Yesterday we were talking about the repositories of nursing research that we are building here in Kazakhstan. So yeah, that is also one infrastructure under the open science infrastructure key pillar. Now, when we are talking about your open science, later on we will be talking about the different challenges, critiques about open science. And this is because there are some individuals who take advantage of your open science. And before we talk about the challenges, I want to bring you back to the values under open science, which we need to go back to in order for us to know how to properly use open science. And it has, there are 4 open science values that we need to look into. The first one is quality and integrity. The second one is collective benefit, equality and fairness, and diversity and inclusiveness. This means that open science should respect academic freedom, human rights, foster top-notch research through diverse collaborations, and widely share research methods and results for rigorous scrutiny and transparent evaluation. Also, open science as a global public asset must be viewed as humanity's common legacy, benefiting everyone. And to attain this scientific knowledge must be openly accessible and its benefit shared universally. Third one, equity and your fairness. Your open science should promote global equity, facilitating equitable sharing of scientific resources and knowledge, regardless of any individual and contextual factors. And lastly, in diversity and inclusivity, open science welcome a diverse knowledge, practices, languages, research topics, and output that meets the needs of the entire scientific community. So we've been talking about language as barrier for research implementation, evidence-based practice. Yes, that is really true, and we need to acknowledge that. However, it should not become the barrier for us to engage in research and share our findings. Actually, what some of the non-English speakers do when they are doing the research, because like I've been interacting with researchers in Japan, China, for example, and Korea, which they do not use also English. What they do is they write their entire research in their local language and then have the entire research translated to English. That, however, is very costly and needs a lot of fund. But that is what they're doing in the non-English speaking. Anyway, this is actually one way to counter the English barrier that we are facing. Now, moving forward, as you can see here in in the next slide, this actually shows us how to promote openness at different stages of the research process. And this is really true. Openness or open science applies to every part or every step of the research process, from research protocols, from the collection of your data, from your data that you have been collected. When you publish your paper, you can do preprints. These are actually the manuscripts that are not yet peer-reviewed, so you can publish them without the peer review process yet. Okay. Also, the reviews, as I have mentioned earlier, from the peer review process, as well as the decisions from the editor, it can be published. So meaning, all throughout, from the conception up to the publication of your paper, can be made available online through open science. Now, what are now the challenges that that open science face? Now, open science, of course, is not free from criticisms, and there are a lot of challenges. And several issues relating to open science has been raised by different experts and groups, including the ones that you're seeing in your screen right now. Ethics and privacy concerns, associated costs. Yes, it's very costly nowadays to do to publish in open science or open journals or open access journals rather. Infrastructure limitations, quality issues, for example, your predatory journal, which I will be touching later on. Publication inequality, publication bias, culture of resistance, and etc. Publication inequality and publication biases, like I'm handling papers in journals, and the common thing that I see from reviewers is when they see the setting out from countries that are not English-speaking country, their number one comment is, have your paper edited by an English editor, without even looking into the quality of the paper itself. So that's so sad, but that's the reality. That's what's happening right now. Okay. All right. Now I was talking about the predatory journals. I will not be talking about the predatory journals as a whole, but you know, open science has also has already been exploited by your predatory journals, and these predatory journals are those journals that you know, act like an open access, but actually rigging the money of the researchers. They do not have a very full process of the peer review process. They publish not quality papers, and they will just get your money. Those are predatory journals, and please be careful with those predatory journals. Now, this is actually the last last part of the presentation, is the future of open science. You all, I hope you are all aware of the Plan S. This is actually in 2018 a consortium of the national research funding bodies backed by the European Commission and the European Research Council introduced the Coalition S initiative. It centers on Plan S, aiming to ensure that scientific data is freely accessible, fully available upon publication. Now, under the Plan S, starting in 2021, that was 2 years ago, all research publication resulting from funding by public or private grants from various research councils and funding bodies, whether national, regional, international, must be published in open access journals, an open access platform, or immediately accessible through the open access repositories without delay. Now, that was in 2018. Just recently, in October 31, 2023, the Coalition S has announced its next bigger plan. It wants all versions of all the articles and its associated peer review reports to be published openly from the outset without authors paying any fees, and for authors rather than publishers to decide when and where to first publish their work. So here, this is the new principles that is being produced by the Coalition X. First is authors are responsible for the dissemination of their findings. Second is all scholarly outputs are shared immediately and openly. Quality control processes are community-based and open to ensure trustworthiness of research findings. Fourth, all scholarly output are eligible for consideration in research assessment. And fifth, stakeholders commit to supporting the sustainability and diversity of the scholar-led publishing. In addition to this principle that is updated principles of your Plan S, the Coalition S is also pushing for a scholar-driven ecosystem. What is a scholar-driven ecosystem? This is the model that they are proposing. Because in our traditional model of publishing, what is happening is after you do a research, you submit your research to a journal, the editor will look into your manuscript if it's suitable for peer review. If it's suitable, it will move forward to the review process. If it's not suitable, they will reject it. That's rejection. And then in the peer review process, the peer review experts will give you comments, and then the editor will decide whether to reject, accept, or minor, major revision, minor revision. The editor will let you revise your manuscript, submit back to the journal, and then another peer review process. That is the traditional way of editorial process that we are doing. But in a scholarly driven ecosystem, once you finish your article, you will submit it into host or like a dedicated platform, and then the dedicated platform will formally check your paper with formatting and etc., and then it will be published, right? It will be available already out there. So authors, experts in different countries can read your paper and then can give you feedback. You can actually correspond to them. And then after that, a formal peer review process will happen. There will be a peer review editor or PPE who will handle the peer review process. And then the peer review process will evaluate, or the peer review editor will evaluate the summary of the review process, but they will not make any recommendations whether to accept or to reject the paper. And then the reviews now the authors will now respond to the review, revise the manuscript, and then the evaluation resulting from this process are openly shared. And then there will be now another editor named the curation editor, which will now decide which peer-reviewed paper to include in the journal or the platform they edit. So they will just be choosing from those articles that are already peer-reviewed. Okay? Now finally, 1 minute. Now what is now the implication of open science to nursing? It has a lot of implication. The mere fact that open science make scientific product available for everybody, it will now remove one of the problems that we identified yesterday, which is your access to literature. We've been talking about the access of research before. Difficulty that will now be removed because open science now will make all these materials available for you. And because of that, it will have a domino effect. It will improve now your evidence-based practice. It will give you more evidence to implement in your practice, and then it will improve patient outcome, patient safety, and patient satisfaction, etc. Okay, so that is the implications of open science to nursing. So I will end my presentation here. Thank you so much, and I will be happy to answer any of your questions if you have.
Thank you, Jonas. Какие вопросы, может, имеете?
Thank you, Jonas. Any questions?
I would like to ask one question for you. Open science. Please tell 2 benefits for us. Why we must to promote this open science? Key message for home.
Okay, yeah. We should promote open science. First is, as I have mentioned earlier, open science is inclusive, meaning it should be for everybody. Science should be everybody. We should not be paying for articles. We should not be paying for any materials that are produced. So it should be available for everybody. So that is number 1. So open science actually promotes that openness. It gives us the materials that we need. Second, it also improves transparency, as I have mentioned earlier. So through open science, if, for example, we publish our data, we can actually verify the published articles if they are actually telling, if they are really reporting the accurate information or findings from their data. So because of that, the quality of research also improves and the quality of evidence also improves.
Thank you, Jonas. It is for this key message, and if you allowed, I will illustrate a very good example from yesterday. I am switch my language in Russian. Sorry for my colleagues. Yeah, but.
I would like to prove that it's important to have the open science. Yesterday, the PhD student, Alexandra, from the University of Astana, presented her thesis and the science in nursing, and she used the tool which open for all, for the whole society community, and they can compare data with the data of other countries. And yesterday she told us that Kazakhstan is on a good path, I would like to say, in somewhere in the middle compared to the no evidence-based knowledge. So that's the most important, which benefit, which we are benefiting from the open science. Thank you very much, Jonas. Thank you. Good morning. Thank you very much, Jonas, for the wonderful report, for the wonderful presentation. I would like to comment, it's not a question. Second day, we discuss the development of nursing education knowledge. Here we have the representative of the practical healthcare, and my message is mainly to them. We understand that nurses want to publish journals, pre-review, but they lack knowledge. At our stage of development, the collaboration with the universities is very important. In the regions, we have our medical universities, departments of nursing education, but in fact, their cooperation, coordination, mentoring will help to publish wonderful articles and works. So I would like to thank our faculty in Nazarbayev University School of Medicine. Recently, our nurses of the University Medical Center clinics launched their publications in Q1 journal. So that's the, I would say, the highest assessment. And our practitioners launched this work. Now another series of publications are being prepared. This close cooperation with Nazarbayev University School of Medicine helps us to start this work. So I invite you to start the cooperation with universities and do these works.
Thanks, Alma. I think that after the launch, we'll have a round table and we'll discuss different challenges and different levels of nurses, those who are working at universities, in hospitals. They will share their experience with us and will express their concerns and expectations. Thank you. We would like to give the floor to Joseph Almazan. He's the associate professor of the School of Medicine, Nazarbayev University, please.
Okay, all right. Thank you so much, Aurelia and Aysat, for a very warm and kind introduction. On behalf of Dora, I am very proud to present my presentation. It's about a review of master's thesis and PhD dissertation criteria assessment. in most postgraduate degree program, whether master's and PhD program, dissertation or thesis is one of the requirements or impartial requirements before we graduate. So when we say master's degree program, I mean thesis research. It is a research project conducted by the students in order to demonstrate their ability to perform or to conduct independent research. While dissertation research, although it's one of the fundamental requirements, but it involves extensive literature review, extensive methodology, data collection, analysis, substantial written document, and most especially, the student need to present and to defend his or her dissertation paper. And sometimes, PhD dissertation paper usually takes 100 pages long. Using rubric criteria for the evaluation of our master's and PhD thesis and dissertation is important, is one of the requirements in post-higher education. Why? The reason is because it ensures transparency, clearness, consistency, fairness, accountability, and of course, a good assessment process. It also supports student learning and maintaining a high academic standard. However, despite of several search criteria, rubric assessment criteria worldwide, the issue is we have different, we have different search criteria. Each universities, academic institution, colleges have different rubrics criteria. So that's why in this paper, we conducted, we synthesized, we assess, we summarize different articles pertaining to rubrics or assessment criteria of master's and PhD assessment. So the aim of this paper is to identify, of course, the assessment criteria of master's and thesis and PhD dissertation in higher education. All right. So we conducted this paper in 5 main stages. As you can see here, in stage 1, we specify research questions. So the first question is, what are the master's and PhD criteria that was published since 2010? And the reason why 2010, it's because we want to provide a contemporary articles from the past 1 decade. And the next question is, what are the similarities or even differences of each rubrics or assessment criteria of master's and PhD assessment? So next is in stage 2, we identify relevant literature, which means we extracted articles. I will show you later how we extracted all the articles pertaining to the assessment criteria. And then we also use search strategy, even the mesh term, and also check the reliability of assessment using PRISMA assessment method. And number 4, this is one of the most rigorous and, of course, needed more time to extract, to map out, and even to chart the articles. And finally, after we finalize and summarize all included articles, we now synthesize and make final reports and share the findings, of course, for research and policy and practice. So how did we conduct it? So we use the PRISMA method, which starting from the identification stage, wherein we use 5 main database, So we have in PubMed, we have 1,407. In CINAL, we were able to identify using the key terms only, 2,229. Science Direct, 968. Scopus, we have 6. And EBSCO, we have none. So after this database identification, we now screened the title, and we were able to report 3,213 articles. And then after the title, we move on to the abstract, and we were able to extract 2,429. And then after the abstract, we move on to the full manuscript, and we were able to assess 56. And then using our inclusion criteria from 56, it downs to 9 articles included in the study. So what are the search criteria that we found out in master's and PhD rubrics assessment criteria? So here, as you can see in this result, so in master's thesis, as you can see here, we have research contribution. So this means that we advancing the knowledge? What's the originality of the paper? What is the substantial contribution of the paper? Next, the research topic. The introduction, methodological approach, analysis and findings, the presentation, and communication. Of course, we also need to add, is there any ethical consideration? The data management, how the data was collected. And then next is discussion, and then summary, and of course, overview. And finally, we also have writing styles and referencing. Meanwhile, in PhD dissertation assessment criteria, as you can see here, we have research field contribution, the depth and the breadth of the paper, the theoretical, and most important, the rigorous methodological process. How the paper was written, as quality of written presentation. Is the paper is based on the international research standard? How about the knowledge of relevant literature? The mastery of methodology, and also include the theory involved, or create a theory. I remember when I have my master's thesis, my paper, my thesis during my master year is that in order to identify, to determine the effectiveness of music therapy among stupor. When we say stupor, it's near comatose patient in the intensive care unit. So it was found out that studies in that music therapy really help improve the consciousness of a stupor patient. So in other words, master's thesis focus more on testing the hypothesis and then making a conclusion based on that hypothesis. Meanwhile, in PhD dissertation, I remember my dissertation paper wherein we created, the format of our dissertation paper is we need to create a theory, and then after developing a theory, we need to test each themes, codes, and categories using quantitative data. So in other words, we started first in qualitative data, and then quantitative data. So, for example, in the theory is disaster resilience theory among older adults. So we have themes, for example, in order to become a resilient older adult during disaster, you need to have a social support, support from the government, financial support, spirituality, as well as hope, And yes, from that moment, we need to test using, of course, a questionnaire based on that particular themes and categories. So in conclusion, the master's thesis in assessment criteria focus on relevance of research topic, literature review, methodology, and finally, presentation. Meanwhile, in PhD dissertation assessment, we emphasize more on the depth of research, theoretical rigorousness, international research standard, literature knowledge, communicative competence, with greater emphasis on significant contribution to the field. Thank you so much for listening, and yes. Good morning once again.
Thank you, Joseph.
Спасибо, Джозеф.
Okay.
Вопросы есть?
Maybe some questions for Joseph. We're a little bit later on the schedule, but anyway. Thank you, Joseph. I think
you
we
so
will
much.
have discussion afternoon with you about how we can to implement this criteria. Thank you
sure.
again.
Thank you so much.
И хотелось напомнить, что
I would like to remind you that in one work package in AccelEd, we had a focus on master and PhD thesis or dissertations criteria. So the next floor is for Lisa Tolonen of Finland. Jump.
Good morning to all of you. So, my topic today is successful achievement of the project results through quality assurance. Regarding the quality assurance and monitoring, the content of my presentation is about the aim, structure, plan and practices, and what does this work mean operationally. An example of the tools which can be used, then about periodical round, and some words about impact and sustainability of the project results, good practices, and then successful achievement of the project results in AccelEd project. The main aim of the quality assurance and monitoring in project management is to ensure that all project deliverables and processes are implemented with high quality. Here is an organizational structure of quality assurance and monitoring, and this example is from the AccelEd project. Key elements in this picture are the quality assurance and monitoring plan, and executive board, and academic advisory board, and then quality assurance team. And the size of the team, it can be different depending on the project, but in AccelEd project, there were 5 pairs, and in each pair there was 1 European partner and 1 partner from Kazakhstan. About quality assurance and monitoring plan. This is project-specific plan, how to implement this work in practice in the project. And the aim of the quality assurance and monitoring plan is to describe the systematic process of producing high quality reliable data and recommendations for improvement actions. And here are the contents of the plan in AccelEd project. Aims of the quality assurance, aims, objectives and deliverables of the project and responsibilities, quality measures, timeline of the quality assurance and monitoring activities, and working guidance of quality assurance activities and quality assurance documentation. Quality management is based on the principle of continuous improvement, so-called Deming's circle, plan, do, check, act. And if we think about the planning phase first, it's about so-called bigger documents, Erasmus Plus program guide, consolidated work plan, grant agreement, consortium agreement. And when we go to the doing phase, it's about management alignment and partnership setup, project plan, project activities and meetings, meetings on work package level, executive board meetings, and meetings of academic advisory board. Different kind of working instructions and document management and control. Check phase in quality assurance and monitoring work is in practice follow-up and evaluation. It's daily quality monitoring, short-term and long-term indicators, feedback from different target groups, mid-term and final quality assessments, and external quality evaluation. And then ACT phase is quality improvement, work, daily work, quality assurance rounds and recommendations for corrective actions, and quality assurance reports to executive board and academic advisory board for decisions for necessary corrective actions. What is this work operationally? Work package leaders, they have responsibility for own leading work packages quality. They compose the midterm and final quality reports with the parts of own work package implementation status. And they carry out needed improvement actions according to the quality assurance suggestions. Then quality assurance and monitoring team in pairs is every half year checking the project progress, is taking care of internal quality reports, midterm and final quality reports. Executive board. This is the management board of the project implementation and is coordinating across academic advisory board and work package leaders and quality assurance, and takes care of periodical project reporting. And academic advisory board has overall responsibility of the quality of the academic and scientific results of the project. At the beginning of the project, risks are listed and assessed. And then during the project, the risks are assessed with different kind of tools. Here is one tool which has been used in AccelEd project, so-called risk prevention tool. You can see here that since the June 2020, this tool has been used every half year regarding the internal quality assessment rounds. And in the column, the fourth from the left, overall risk score, it's essential part of this form. Risk score 9, if the risk score is 9, implemented actions and planned improvements have been reported every half year to executive board and academic advisory board. And if the risk score has been 6, actions have been reported in every internal quality reports. Every 6 months in AccelEd project, there has been the first quality assurance and monitoring team meeting, and the purpose of this meeting was to launch the data collection. And about 1 month later, we have had the second quality assurance and monitoring team meeting, and it has been the situational check of data collection. And then in the executive board meeting, the key findings and improvement suggestions of the internal quality assurance and monitoring reports have been presented, and improvement and suggestions are discussed and recorded in the meeting minutes with clear deadlines, responsibilities, and follow-up measures. And then academic advisory board in the meeting of it, which has happened once a year. It has an overall responsibility of the quality of the academic and scientific results of the project. Yesterday we listened presentations regarding work packages, and in each presentation there was a strong focus in the impact and sustainability of the project results. Here's one example on how the impact of the project can be assessed. Via inputs, outputs, outcomes, and impact. And first assessment can be done on work package level, and then it needs to be widened to the whole project. And as we heard yesterday, it's very important that impact and sustainability are thought from different perspectives and on different levels. Here the levels are individual, personal, institutional, higher education sector, and society. But they can be also national, international. It depends on the project. Good practices of quality assurance and monitoring. On its best, this work is a shared issue in a project. Everybody should take her or his responsibility for quality assurance work. And quality assurance related roles and responsibilities of project members are important to define. For example, who takes overall responsibility of risk management. And it's good to do quality assurance activities and project management in close cooperation. Quality assurance plan, it should be as concrete and compact as possible, consisting of essential procedures. And this plan is reviewed and updated during the project. For example, in AccelEd project, it was updated 4 times. Reporting the QA quality assurance findings every 6 months, so regularity is the key element. And indicator monitoring is good to be timely so that it can bring quick information supporting operations. And it's important to pay attention to the follow-up of the improvement actions recommended by the quality assurance team. And collection of baseline data at the beginning of the project helps to evaluate the impact of the project. In the AccelEd project, successful achievement of the project results, outcomes, and impact through the quality assurance was based on the daily long-term and committed cooperation following the guidelines of the quality assurance and monitoring plan. The event deliverables, report deliverables, and teaching and learning materials were of high quality, and the indicators per work package were reached. Based on the information produced by the quality assurance, it was possible to monitor and ensure the quality of the project. And this conclusion is also supported by the results of the external evaluation, quality evaluation carried out in the project. The quality assurance system ensured the successful implementation of the AccelEd project and the quality of the results as well as the impact of the project. Thank you for your attention, and big thanks to the AccelEd project, everyone in the project, for good cooperation related to quality assurance and monitoring work. Thank you.
Спасибо большое, Лиза.
Thank you very much, Lisa. From our side, we would like to say thank you very much for coordination of the work of our teams, ensuring quality and risks.
To tell for you, Aijat, she expressed very big gratitude for your very good job during ensuring our quality in this project. Thank you again.
Есть ли у вас вопросы?
Any questions? if there are no questions, then we have break according to the program. Please, those who didn't fill in the questionnaire, fill in the questionnaire, and being back in time, 10:50 will be the next section, the section of the young scholars. So please be in time so that our young scholars will not be afraid and not escape.
Yes.
Work. Yeah.
Сәлеметсіздер ме, құрметті әріптестер, студенттер, конференция қонақтары. Келесі секциямызды жалғастырыңыздар. Секцияның аты мейіргер ісі ғылымы және зерттеулері жас ғалымдар секциясы. Секцияның модераторлары біздің
Good morning, distinguished ladies and gentlemen. Let us start our event. My name is Dinara Nurgalieva.
And welcome to this third section of this conference. I greatly want to welcome you, and so we will start with the first presentation. And the first presentation today, here in this section, is Kumusbekin Ibrahimova, who will give presentation on quality of life of patients who have had pneumonia. And Kumus Begin is a second master year student of South Kazakhstan Medical Academy, SKMA. So welcome.
Добрый день, уважаемые участники конференции.
Hello, distinguished participants of the conference. Topic of my report is the quality of the life of patients who have had pneumonia. Pneumonia stays one of the serious disease globally. And the structure of the mortality, pneumonia rated fourth. And it continues to take the leading positions, which leads to the fact that people lose their work and cannot be active. It has different implications for the health of the patient, and of course it affects the quality of life. Rehabilitation, physical rehabilitation, is an integral process of the treatment for patients with pneumonia. The purpose of the research is to assess the quality of the patients who had pneumonia as a result of the comprehensive rehabilitation activities and procedures. Our research was done in the pneumological department of the Turkestan Central City Hospital. 30 patients have participated in this research, 13 male and 17 female, aged 60 to 70. Average age of them was 42 years old. They had pneumonia and have been passing the rehabilitation stages. On this slide, you can see the structure of the questionnaire SF36. The questionnaire consists of 36 items which are grouped in 6 scores: physical functioning, the general health, pain, emotional functioning, social functioning, life activities, and mental health. Psychological mental health. Since, as I've mentioned earlier, the assessment was done thanks to the rehabilitation, we also compiled the rehabilitation program with a duration of 2 weeks. The program of light post-pneumonia activities was developed in accordance with the clinical protocol adopted and approved by the Ministry of Healthcare of Kazakhstan 10th September 2020. The rehabilitation plan included mental support, the breathing exercise, postural correction, walking, and of course some light physical training. Before the rehabilitation, patient had problems, a headache, difficult breathing, coughing, and they had reduced tolerance to physical exercise, and we have assessed the level of breathing, which was abnormal, and the problems with the respiratory system. On this slide, you can see the analysis of the life quality of patients who had pneumonia, groups which we had studied before and after. So we observed that after rehabilitation, before rehabilitation, they had the low life quality, a low level of health conditions. After the disease, they are still the remnants and these residuals. And it again led to the reduction of the indicators and the components of the life quality. On this slide, we see the analysis of the quality of life of the patients with pneumonia before rehabilitation, after rehabilitation. That's the test result of the group. After rehabilitation, we observed the improvement of all the components of life quality. The physical component, we observed the increase according to the scale of physical function and neural function, physical pain, and general health condition. Based on the data we received, we can conclude that after rehabilitation, the functional possibilities improved for the physical activity, workload, and here in the psychological component, we observed the better social function, emotional function, better mental health, and this data prove that the patient, based on the rehabilitation activities, improved life, better energy and social activity, or improved energy and social activity. The results received show that after pneumonia, patients, we observed the low life quality among patients, and this is due to the pneumonia they had earlier, and it limited the physical activity we observed in patients before disease. After the research, we see that they could work of 6 minutes more, better breathing, and the subjective assessment indicators according to work scale are better. After rehabilitation, patients observed the improved physical health, the more blood and oxygen, and this witnesses the better function of the respiratory system. Thank you very much for attention. Thank you very much for attention. If you have any questions, please, you can ask. We are ready to answer.
Okay. I was, thank you for this nice presentation and nice work. I have a question for you. Can you tell us a bit about the rehabilitation program and the role of the nurse in the program? Is that too much? Just a bit about the role of the nurse in the program. What did the nurses?
Кумушбегом, наш уважаемый профессор, Тора спрашивает.
Kumashbegim, our professor asks what was the rehabilitation program you applied or you will apply, and the role of the nurses in your work. Translation. A physical rehabilitation, mental rehabilitation component was included in the program. Physical rehabilitation, mental rehabilitation.
Training and exercises that nurses are supervising in collaboration with physical therapists.
Какие физические упражнения, да, или же гимнастические мероприятия делают медсестра в...
Translation of your question. Because the speaker is not, doesn't have the headphone. So first of all, that's the breathing exercises, which reduces, of course, coughing.
Рахмет Кумушбека Ибрагимова.
Thank you very much, Kumishbek Ibragimova. Distinguished participants of the conference. Next is Gauhar Alibayeva. Gauhar Alibayeva, Dana Utelieva, West Kazakhstan Medical College, Uralsk, the issue of expanding the competence of the nurses on the level of MPCP. So, hello, distinguished ladies and gentlemen. The topic of our report is expanding the competence of nurses at the primary health care level. So, the World Health Organization considers the primary healthcare is as an important component, and nursing is an integral part of the healthcare system, which has the respective human resources and real potential to satisfy the needs of the population and the accessible healthcare. Here we speak about 6,000 specialists. The purpose of our research is to develop the optimum ways to increase the quality of the primary health care in the medical institutions through the comprehensive approach of the work of nurses in the primary health care. Within the 2023, we have analyzed the competences of the nurses and compared with the competences of the graduates of our college. On the screen, you can see the assessment form of the nurses. So for one of the polyclinic in Ural city, here we see that some competencies like the rules of identification of the patients, the paperwork, the cleaning, the current cleaning practices, and others. In the research, we observe that the number of the clinical competences of the nurses in the polyclinics is varied. One polyclinic has 10, another 32, 20, 16, so they are identical. In the research list of competences, there are no competences like management, quality, training, guidance, research approach, and the evidence-based nursing. So the scale system for all nurses is not valid when we apply it to the newcomers. There are no scales which will show the achievements of the nurses. We believe that in the forms of assessment of competences of nurses, mainly there is a set of basic procedural skills of the nurses. The information about the level of competencies of the nurses, except the observation, shall be collected using the following tools, like participation at the conferences with the report, participation in the seminars, publications, recognition by the patients and other colleagues. To identify the further improvement areas of the professional work and the perspectives for the career growth, we believe it's important to have the individual development plan of the specialist. That's a set of measures aimed at the development of nurse, professional development of nurse, the career growth, professional development, and better, of course, quality of her services. There is no, in all 6 polyclinics, there is no individual development plan of the specialists of primary health care level, which is important for the professional development. The outcomes. To strengthen the intersectoral cooperation of the college for the promotion of the nurses, there was no standardization of the list of competences assessment as a single one, which is approved and used by all healthcare institutions at the primary healthcare level. There is a need to monitor over the development of the medical healthcare specialist and identify the further improvement areas for their professional development. Thank you very much for attention. Thank you very much, Dana Utilieva, for the interesting report. So, ladies and gentlemen, any questions? Tora, I think, yes, has a question.
Presentation and Gaukar, it's very interesting. And I would like to inquire a bit about the individual development plan or the career growth of the nurses. What did you see when you say we need to monitor? There was lack of monitoring, but what would you like? What did you see in terms of career planning? Or yeah.
Да, период. Да.
Уважаемый профессор спрашивает, для чего вы хотите проводить?
So the translation of your question, I think we should advise to the speakers to take the headphones with themselves when they go to the stage. So now the translation is going on.
Нет.
So we haven't yet developed the individual development plan, but we would like to advise the board of the nurses that accept the basic competencies which are in the assessment list. For example, the pressure measuring and others, pulse measuring, to include in this individual plan the achievements of our nurses, because our nurses, they do a lot of self-education work. They publish a lot of articles, participate in seminars, so that to observe their professional achievement and career growth.
Спасибо.
Another question, Natalia Pushkina, Polyclinic 9, Astana City. The question is about competencies. I didn't understand the slide. Can you go back to slide number 2? So this slide, this is the competencies assessment form, which is introduced in one of the polyclinics. Yes, it is used and introduced. Then one comment on the competences. There is decree 305, and it has the job description in this decree. So therefore, documentation turnover is the job description of the nurses, similar to the other items. So I believe you have to include in the competences list if the person, for example, continues self-education, self-training, if it's the nurse of the polyclinic who received the certificate of some reanimation, some rehabilitation nurse, and the skills which he received shall be included in this competences form. Thank you very much for the question. We know that there is a decree 305 dated 2020, and I think this issue will be tackled. We didn't have the coordinator of the nurses, but now she is elected, very professional specialist. And I believe that all will be according to this decree, and for all polyclinics, everything will be single. The rules and the procedures will be single. Corporate Fund, EMC, Dinara Shakenova, I have a question. Through developing a single competencies for the nurses of primary healthcare level, how it can impact on the professional development growth of the nurse, because I believe that they cannot be single competences. Each nurse can have different competences, so you can't achieve or reach this single competences template. So I believe yesterday there was the reported from the Corporate Fund MFC that in the health institution there shall be career growth of the professional development of nurses, so that the nurse know on which level her competencies are and what she shall achieve in the future. Through obtaining additional skills and knowledge, she can grow or develop further. So in my opinion, they cannot be single template, and you cannot reach this. I believe here you should focus on competences in a from the different angle. Every nurse shall obtain new competencies, and in this form she should show what additional skills she obtained during her work. Thank you very much for the question. Yes, we want to introduce individual development plan so that to show the competencies there. As for the theory, we want to be guided by Patricia Ben theory, starting from the beginner, expert, professional, and other. Only thanks to this tool, for nurses will be motivated to transit from one level to another level, and to develop the programs and research in her organization. Thank you. Hello, distinguished colleagues. I work for more than 20 years in primary healthcare institutions. So it's a very clear issue for me, and actually the painful one. I agree with the colleague that we can't have these competencies in primary healthcare institutions as a single ones, because our field of activities are vast. All primary healthcare institutions are mainly have the dispatching service, and to have additional individual development plan for the nurse as an extra workload is impossible, because the nurse who has the population of 1,700 patients under control, and sometimes 200, 2,000 in one section, 90, 100, 900. So just imagine the workload she has, the nurse. And she is responsible for tuberculosis service, for screening service, the dispenser, oncological department is her responsibility. So we have to focus now, if we want to have the quality-based work of the nurse. So we have to think how to reduce the workload of her, and not to have her additional extra work on developing the individual plan. Of course, we have the specialized, for example, diagnostics department, which has their own competences. We have the midwifery department, and there are different competences. So when we develop something for our nurses, so that we should not have extra workload, but vice versa, standardize or simplify her work. That's our task. In primary healthcare institution, there are a lot of work where we have a lot of functions, and job description is expanded. So, and in primary healthcare institutions, we should focus on each nurse, on each section of work, because we have immune prevention activities. So if we'll have established prevention activities, then 90% of the work will be reduced if it will be on the initial level best quality of work. So our nurses, their work shall be reduce in terms of workload, like reports, papers, as usual in primary healthcare. We observe this. Thank you very much for the question.
I would like to say that the senior chief nurses will make this list to see the achievements of our nurses. Talking about senior nurses of primary healthcare institutions, they're very loaded with work. Yes, of course, we should do everything possible to have additional pay to those who are involved in education of on-job training of nurses. But the reality is that we have the only one, a senior nurse, a chief nurse in the healthcare institution, and actually, so I think one staff member should be introduced, another staff member should be introduced to be in charge of this. Yes, we agree with you. The role of the nurse is very important on the level of the primary healthcare, as they are involved in primary, secondary, tertiary prevention. There is a huge scope of work PHC is the foundation of the whole system of healthcare, and they're trying to do everything possible to provide high quality medical services to children, adolescents, and adults. So I would like to wish you to make your work a contribution into the clinical practice. Your work should simplify the work of nurses, and it should be the that document which will motivate nurses to do the Trinity of nursing: clinical practice, research, and education. Thank you.
The next speaker is Laura Gusmanova, Gulmira Almakbetova from West Kazakh's Higher Medical College, Uralsk City, nurse as a leader and initiator of change in healthcare. Welcome.
Здравствуйте, уважаемые участники.
Hello, distinguished participants of this conference. Welcome to this section, and I would like to present you the research on the role of nurse as a lead initiative changes in healthcare. Our objective was to learn how we can develop skills in nurses. So the objective was to analyze the leadership qualities of nurses and their role in healthcare. The tasks were to consider the role of a nurse in healthcare, to identify the leadership profile of nurses, to learn better about the model of leadership of nurses globally, and to define the challenges, and then to develop the plan of development of the skills. So the relevance of our project, and we hope that our research will help to define the leadership skills which will lead to better clinical practice results. Hypothesis of the research: we consider that nurses are the key leaders who may initiate changes in healthcare and lead to practice improvements. In our research, we've used statistical methods, ANOVA, correlational analysis, regression analysis, quality data analysis, logistic regression, and we've carried out the surveys among the nurses using website. These are the methods we've used. ANOVA, the assessment of interaction between the knowledge of a nurse and their leadership capacity, identifying dependence of the level of education and experience and leadership qualities. Then correlation analysis, again, achievements and leadership capacities of the nurse. Regression analysis, that was the check of the hypothesis of the fact that nurses with high level of education have better leadership skills, and we've analyzed interaction of the teams and leader nurse. Quality data analysis gave us the notion of the leadership qualities of nurses in different countries, and we identified the reasons why some of the nurses have better leadership qualities than others. What is the role of a nurse in healthcare? This is the supervision of patients, so the nurse is always at the bedside, then documentation management on each patient and keeping order. Communication with patients, this is another important role. This is a key source of information for patients, and nurses provide psychological support to patients. These are the key leadership characteristics. Respect of the opinion of their peers, doctors and patients. Responsibility for their own work and the work of their team. Inspiration. The leaders should inspire their peers to improve the quality of patient care, communicative skills, perfect communication skills, and ability to organize the team work. As initiative changes, nurses may create new work processes and become a leader in introducing them. It may they may become a person who participates in education, and they may start the initiative of their project on improvement of patient care. Leadership model, transformational leadership, when they use their personal qualities to inspire their team and bring to new levels, then serving others. The interests of a team or patients are higher than their own interests. Leadership and training capacities, they are developing their team. The advantages of the active role of a nurse. This first is the quality improvement in treatment, and hence the level of satisfaction of patients grows. Then improvement of labor conditions. Those nurses who participate actively in the improvement of healthcare may improve the labor conditions of their colleagues, and public health improvement. Nurses being leaders may help to improve public health through their initiatives. So now talking about challenges leader nurses face. First, lack of support. Nurses are very often the leaders, but they are not supported by their peers and administration. Number two, not enough education or training, lack of some knowledge. Interpersonal or communication issues. It's very hard, especially when a nurse wants to become a leader. How to develop leadership skills in nurses? First, we need to introduce a training program for the nurses to participate in these training programs to develop their skills. Number two, reading literature, relevant literature, which will help them to motivate themselves. And mentorship. A nurse may become mentor for other nurses and lead them on their pathway. The role of a nurse in modern clinical practice. First, care and supervision of patients. That's the key role, and first aid provision and team work is improved, and of course better medical help. And number three is patient documentation or filing system management. Our research showed that nurses are key leaders in a healthcare system, may play an important role in changing the whole system of healthcare. These are the questions we asked our nurses. What is the essence and significance of the role of a nurse in the context of leadership and initiating changes in the modern healthcare system? They answered that there is a need of professional associations and organizations and nursing community and social media, colleagues, mentors, patients and their families, administrations, and the managers of healthcare institutions. Second, which factors and challenges may influence the opinion of a nurse to be a leader and initiator of changes? Colleagues and employees, professional association, training development, mentorship, and ability to introduce quick changes. These are the challenges. Lack of recognition, lack of support, and when the interview took place, I'm not going to read all of these opinions. Some people said, like one nurse of a polyclinic said, to solve these issues, medical and like nurses may work on developing their leadership skills through ongoing training and participate in professional associations which contribute to their recognition and better role in healthcare. And Deputy Director on Healthcare said in one of the institutions that access to education and abilities and may be limited for nurses because of lack of funds to pay for this training or time. Challenge number two, resistance to changes. According to the opinion of a senior nurse of a hospital, the attempt of nurses to become leaders, initiative of changes may be negatively perceived by traditional conservative administrative structures. Because there is a traditional hierarchy and an old obsolete structure, organizational structure in the institutions. So these were the challenges. How we can solve them? The organization of training in leadership, management of the changes introduction process. This is the SWOT analysis. So, of course, advantages the development of leadership skills for efficient leadership. This also will improve their self-esteem. It's for weakness, overloading with information and resistance to changes. Another strength is that nurses participate in decision-making, having leadership skills. So they may be involved in strategic decision-making in particular. This will, of course, improve the patient care and the quality of this process. And weakness is that there may be conflicts with their colleagues, uncertainty, and lack of confidence in themselves. Another opportunity, better career paths for nurses, including possibilities to take higher positions. And another weakness is that nurses are lacking time, they don't have enough money. And another strength is that they adapt to changes. Leaders try to go through this process quicker. They're doing this process quicker. And the weakness is negative, like deterioration of their health. So, generation of our ideas. The analysis of the role of nurse in managing the process of healthcare, then impact of education on the leadership qualities, development of programs, or designing programs of leadership for nurses, analysis of challenges and successful cases, comparative analysis of leader nurses in different countries, efficiency of leadership initiatives, and then impact of technologies on the leadership, and assessment of leader nurses by external stakeholders. And our ideas are the following. We would like the education and professional development of nurses to be funded. They should learn more topical research, read more topical researches, read articles, and the network of professionals, community should be established. They should participate in different associations, in the networks of nurses. So this is the ways to solve the challenges mentioned before. Projects and research should be carried out, and they should interact with administration. They should be self-assured, persistence, stick to their values and ideas. The fact that the leader is an authority, it's clear. They should create the network of professional contacts. They should optimize their resources, introduce new technologies, should be involved in education and look for investments, public speeches and exchange of opinion. This is the leadership quality pyramid. To be a leader, you need to have professionalism, competences, coordination, communication, initiatives, and entrepreneurship skills, education, and impact and management. New technologies, cooperation in team, patient-centered approach, and no resistance to changes. So, how we could solve this issue? We could create the center of nursing leadership development. Here we could train them, mentor them, analyze data, establish cooperation with different administrations of the medical institutions. And I would like also to mention that having studied those challenges nurses face, we consider that the idea of organizing training in leadership is very urgent and relevant, and I hope that our idea will be supported by nurses not only in our region but all over Kazakhstan, as it is very important because we would like to educate better nurses with leadership quality. Thank you very much.
So much for this presentation. I was wondering, do you have questions to her? Yeah? Please. Yeah? Welcome.
Включить Рыспухамедова Майра, Green Clinic, главная медсестра, город Астана.
Green Clinic, chief nurse. Do you consider nurses with high education as leaders only? Yes, because education is very important. No, you're not right, because nurses with high education don't have leadership skills. Sometimes a nurse with college education, with many years of experience, like district nurse, may have better leadership skills. Why don't you see potential in that cohort of nurses? But it's better to find those who have the leadership potential and then to train them. One of the items is that education for nurses is important, but you will find that person among ordinary nurses. I really wants to answer. Thank you for a very good presentation and for a very good question. You know, we are talking about leadership on different levels, and each nurse may become a leader. But our speaker was talking about vertical leadership. She mentioned that education is very important when you're a chief nurse in a major hospital. Each nurse in its job may become a leader. For example, I joined your team recently, and you work in a hospital. You should be a mentor for me. You should be a leader on your own level, on your own position. This is what our speaker wanted to tell you, and your question was very relevant. Thank you.
Explanation in this.
Спасибо большое за объяснение.
Thank you very much, Aurelia, once again. I would like, of course, we would like to look through the figures of your research. You mentioned the methodology, and you said that you use a few methods like relation analysis, regression analysis. We'd like to see more figures, and there is a plan of presentation compiling when you show the results of your research, and I would like to wish you to take into account all those issues, and next time when you present the findings of your research, you could include this into your presentation. Thank you.
Следующий доклад.
The next speaker is Dayan Sagadiev, 4-year student, Higher Medical College, Danalik, Astana, the nursing department. The topic of his report is the role of modern nurse in the organization of the nursing process and in the establishment of a nursing diagnosis.
Здравствуйте, меня зовут Сагадиев.
Hello, my name is Sagadiv Dayan, student of the fourth year student Higher Medical College Danalik, and I would like to discuss the topic which was mentioned by the chairman of the section. Thank you very much for the opportunity to speak at this conference, present my results. Important was to choose the topic which will be valid or respective to my competences. And the materials which could be received by me is a bit a different level compared to the previous speakers. To have a subject-based discussions, I would like to start with the background. Yes, see, there is the instrument tool there for changing the slide. So Bologna process, this is a meeting on the level of the ministries and agreements between the European countries aimed at ensuring the comparability of standards and quality of qualifications of higher education and the level of education among students. In 2010, Kazakhstan became the 47th country which has signed the Bologna Declaration and became the first Central Asian country which was involved in this process. And it led to some changes, and one of the change was the three-level system education, bachelor, master, and PhD. That's the system which we have today. However, it has it's not really applied in medical education as of now that much. In 2020 on December 21st, there was a decree on the nomenclature of specialties and specializations of the healthcare specialist, and it divides the jobs of the nurses, job description. As of today, the job description of the nurses include under the supervision of the nurse of the expanded practice to have the nursing care depending on the needs of patients and to set the diagnosis. And there is a term of nurses diagnosis appeared. Given the dynamics of the disease. And then the doctor sets the clinical diagnosis. That's the changes which we never observed 20 years ago, and they appeared with this decree. So here I would like to discuss the challenges which you observed. So the nurses of the general practice doesn't want to enter the bachelor or master or PhD degree, and these fears are clear because the degree is huge and it has changes and obligations. And if you are the nurse of general practice, you work, and now you are told that you have more jobs than described, then of course she will be afraid. And now nurse has to do more work for a bit extra salary. Now they are delegated. It's not my words, but the words of the nurse. They are delegated the part of the work of the doctor. So, and the myth was observed after this decree. And to check whether the theory is true or not, we decided to question the nurses in polyclinics and clinics of Astana city, where we questioned nurses whether they consider that the notes received in the colleges are relevant. On this slide, you can see the changes of the nurses of the general practice. This is the nurses organizers, the nurses teachers, the nurses researchers, the nurses of the high-tech medicine, and the clinical nurses with the right to take decisions themselves. So we have taken as a basis the state exam after the medical college, because this exam reflects those requirements which apply to the graduates of the college and to the nurses of general practice. And we found out that the state exam has the questions which are aimed at nurses of expanded practice initially, and they comply fully with the new decree. I would show you some questions, and some of the questions are please name culpitus, which kind of which kind of medicines you have to use. So that's the questions mainly to the doctor, because to identify the diagnosis is not the obligation of the nurse. However, here there is a possibility of nurses to diagnose the patient, but we believe that this is the clinical diagnosis which will be done by the doctor. After the questionnaire, we found out that the green are the nurses of general practice, and the other blue is the expanded practice. 92% said yes, this is knowledge are relevant, needed, and they support this new decree of the Ministry of Health. But with the nurses of the general practice, 68% considers that this knowledge are relevant, but it's not big number, 68%. I have a theory that it because there is no enough public awareness towards the need of the higher education. And within these 2 days, so we hear a lot of speeches, and they were that nurses shall be leaders, nurses shall be managers, nurses shall be do this, nurses shall do that, nurses shall be everything. Of course, any person will be afraid of this set or range of obligations, and they would not they would reluctant do this. And now the purpose is that the nurse is not just to put an injection, bring this or bring that, but it's research work for them. And we have to choose the alternatives for the career growth. We can be teachers, professors, we can be researchers, and research the nursing together with the issues of the clinical work. The first was Zoom conference with several stages, and there was the leader of the research, and we explained the positive part of this decree, and in Europe how positive there was an impact, and consequently the statistics have been changed a bit. The nurses of the expanded practice showed some shift, but it was expected. However, the nurses of the general practice have assessed the opportunities provided to them, and this all was done within months of the work. Stories of the opportunities which are available now. What does it say? It says that nurses are not explained truly what is the applied bachelor, academic bachelor mean, and whether does it make sense to enter further, continue education further in bachelor, and what the purpose of the new degree at all. The conclusions. Some part of some medical, the nurses doesn't think that it's relevant to apply the practical skills related to setting the nurse diagnosis or to compile detailed nursing process, joint participation in diagnosis, and additional questioning was done after the conference showed the positive attitude of nurses to change the job description of them and obligations of nurses currently. Some of us are students of the medical colleges, medical universities, and the approaches are different, but I'm sure that it shall be done in more informal settings, and better explanation of this decree, so that this decree will be perceived as the opportunity, but not as something which no one would like to do. Thank you very much, Dayan Sagadi, for your report. Professor Aurelia, as the recommendation or feedback, I think. Yes. Thank you very much for the wonderful presentation, for your bravery, that you are fourth-year students. Students are not that brave usually. Thank you very much for this. But I would like to answer, but also provoke the discussion. In Lithuania, there are changes going on. 2 days ago, we changed our preferential documents and expanded the functions for nurses on the primary health care. You say that they will be afraid of this workload. That's true. Fear shall be there. Fear is there because we are nurses who graduated 30 years ago and didn't receive knowledge which are needed today, given the competent list of form. The previous speaker said that we have to develop the plans for our development so that the fears which we can have could be disappeared, so that we know what the applied bachelor can give us, what does university can give us, and what are the competencies framework we have, because not any nurse with any education can carry out all this framework which is given by the Ministry of Health Care. And we have to think about cascade competencies in clinical practice. So every nurse has to receive job which he was trained for. We can't offer a job to the nurse which she never was trained for, and will develop a degree for all levels of nurses, because the profession of the nurse, similar as IT or mobile phones, if you buy today, tomorrow it's old. Similar to our knowledge, they are becoming old every day. So to your question, the functions were given extra function, but money, extra salary was not given. If you have increased salary, but would we feel ourselves more confident in our job? That's the issue which will lead hopefully to discussion. So if my functions will be expanded, my salary was increased, but I don't have this knowledge to do the job, then I go to my job, do mistakes, patient die, but the salary is higher. Can I answer your question? Yes. First of all, I believe, thank you very much for your question. First of all, it's not the provocative question, but it actually supports what I've mentioned. Since the functions are more, salaries increased, but the issue is in fear. So there are two types of fear. Fear which you expect, let's say, but in a nice way, that something new will happen. And second fear, if there is uncertainty. And I said that nurses were not ready to the changes which have happened now, and it's not because they are stupid and doesn't know any changes that can happen. It's a prestigious work to be a nurse, and the potential shall be more paid to this profession as nurse. The only problem was there were no public awareness which will motivate nurses to have a positive view on the expanded functions and to have rational view on this increase of functions. Thank you very much, Professor Aurelia. There is a queue to the questions. For further discussions, as for the reports, thank you very much. A very interesting report. Given the experience of the clinics where I work now, it's a corporate fund, EMC. We had the training on 024's program, development of the career growth, professional development for the for the nurses. And we worked on this career growth, and ultimately we came to the fact that there shall be two career growth for the nurses of general practice and for the nurse of expanded practice. It will enable nurses to have motivation to go on this career growth journey, get additional skills and knowledge, and they will not be afraid. They will see what is their level now and what competencies they should receive to have further growth in their profession. So I believe it's one of the decisions of this problem. Hello, the Higher Medical College, the municipality of Astana. I would like to thank this young researcher for being brave to participate, to give a speech with this in this audience. It's not a remark, but maybe given that our young speaker doesn't have a practical experience, I would like to share with my experience. The program of the applied bachelor started to be developed from 2004, and this explanatory work was countrywide. And I believe in each region nowadays all nurses know what level of education is available in the framework of nursing education in Kazakhstan. So it's the nurse of general practice, applied bachelor, of expanded practice. As for the decree 305, that's the decree about the job description. So the nurse of expanded practice can be a specialist who graduated from the applied bachelor or academic bachelor of nurse education. The nurse of general practice can be only the nurse of general practice. So to say that it leads to the fear among nurses, but they are trained for this and they have chosen this profession. And I believe every nurse has a choice what level of education to receive and what to do in their profession. So that I would like to give my feedback. That's the feedback from my side. I would like to thank that given that we have these young people who speak on behalf of the nurses and about the profession of a nurse, we have to applaud. So there is some truth in his speech because we have started to discuss these issues with the applied bachelor. And there are different salaries for nurses, different competences, skills, and we started to differentiate the work of the nurses of general practice, of expanded practice, different workload. So, and I would agree with you because having similar diplomas of nurse of expanded practice, we still have different specialists. Some of them were perceiving a job quite well, understood the job and do the job with pleasure. They're motivated not only by salary, but in general, they independently work with the patient, and the nurses who understood their job. We observed the satisfied patients of their work. But people are different. Some people didn't perceive their new job and someone stayed, someone decided to quit. So someone liked, someone disliked. It's a human factor here. But the thing is to be motivated to have higher education is big because most nurses, they continue their education in high institutions because for many years they didn't have the career growth opportunities and now they have it. Thank you.
I would like to take your comment as well, and I agree that the motivation is quite high as according to the statistics. Most of the nurses were in favor of those changes, and we're working on explaining the nurses that the need of applied bachelor degrees needed, that there is variability here. And I didn't have the task of persuading nurses that it's needed. No, I just wanted to analyze the the processes. Some of the nurses don't understand why they got this degree, and but I would like every person taking a step consciously, a step in their education career. I agree with you completely. I would like to thank this young man and to invite him to our corporate fund, UMC, and I guarantee that you'll have a career growth because it's impossible to grow vertically only. It is possible to grow horizontally. You will be one of those young people who will develop their career in our center. Thank you very much, and understand your pain as a student because I am the president of Paris Association of Nurses, and I invite you to this association as a representative of a young generation. And probably it's very important to introduce in payroll the nurse responsible for care. For each organization in healthcare, it would be very important to introduce this position. Currently, I understand that there is no clinic with this position. And probably because of that, it's difficult. So you are invited to our center.
Just want to comment and congratulate all the presenters. I have a comment or an insights from the perspective of a nurse educator for all of who are here today. It is true that the nursing diagnosis is a difficult part of the nursing process. However, I'd like to remind everyone that the nursing diagnosis should not be eliminated in the nursing process because in the 1950s and 1960s, it is Ida Jean Orlando from the United States, the nursing process theory, that give us a unique stand or perspective on developing nursing science. In addition to that, we educators should taught our students or nurses on the applied bachelor and academic that we have to do nursing diagnosis. It is part of our responsibility. The nursing diagnosis is critical for us to apply for our critical thinking, for us to analyze what are the signs and symptoms really means, and for us to develop our own nursing care plan, which is different from the medical perspective. Thank you very much.
Thank you, Paolo. This was wonderful insight. And thank you, what's his name? Dayan Sakadiev. Yes. Dayan Sakadiev, where are you? Thank you for the presentation. Yeah. The next presenter, I would like to welcome Rinat Kulaibergienov, assistant of the nursing department, Astana Medical University, and he is going to talk about No, he is not going to talk about that. Yes. We have problems here. He is going to talk about the scientific basis for... Coronavirus. Okay.
Сәлеметсіздер ме, құрметті ханымдар мен мырзалар, әріптестер және де қатысушылар.
Hello, dear ladies and gentlemen, dear participants. My name is Rinat Kulaibergienov. I am the assistant of the nursing department from the Medical University of Astana. Today I'm going to talk about the scientific basis for advanced training of nursing care in the context of new coronavirus infection. So the topicality, the coronavirus is a new respiratory infection provoked by SARS-CoV-2 So it stems from China, Hubei, and this coronavirus impacted all the aspects of the nursing work. The nurses had to provide care in new conditions, use new methods of prevention and the disease prevalence control. Talking about the objective of this research, this is the advanced training of nurses in the conditions of coronavirus. We carried out sociological survey to assess the professional skills of nurses in primary healthcare institutions. We've analyzed the workflow of nurses in a PHC. We've developed recommendations. We carried out horizontal study. We carried out the study among the medical professionals and patients in the CMA primary healthcare institution. So the methods of research, different methods, there were respondents. The average age was 63 years old and 53. So breakdown by gender, 52% are women, and 29% of patients were satisfied with the manipulations. The rest 62% said no questions as for different manipulations. Where I explained the essence of the medical manipulation. So the patients answered, 28% said no explanation was given, and the rest said yes, explanation was given. The results of this study. Are you satisfied with the treatment conditions? Were you consulted by a nurse? And how do you assess the work? About 3% answered that they are not satisfied. 46% said that they are partially satisfied. Another question about consulting from the nurses, whether enough consultation was given by the nurses. The results of the study. Were there any conflicts with nurses? About 13% said that nurses were needed for the patient. The rest questions, whether the nurses carried out procedures in a timely manner. More than 60% said yes. Whether the manipulations were done timely, and if not, why. More than 60% patients said that sometimes they do not perform manipulations. And another question about psychological support by nurses. The patient said no psychological support by nurses was given. Appearance of nurses. Question about appearance of nurses. So how do you assess the appearance? More than 70% said that they look tidy, and the rest said they are not that tidy. Talking about hygiene, no one had given the answer. How do you assess the attitude of health professionals towards you? Many said that they are partially satisfied. And some patients said that they that the nurses didn't give them enough information about coronavirus prevalence. They didn't inform them about clinical symptoms. So the census actually signal that the relevance of the role of nurses is very high. Moreover, the life of nurses during coronavirus was under threat, and of course, interdisciplinary team efforts are needed, and advanced training of nurses is needed based upon this study, as the nurse is very important for the whole system of prevention. Here we also have to carry out training in management and in psychology. So nurses have to be a little bit of psychologists.
Questions in the audience? Do you have questions?
Dora, I have question. May I?
Yeah, Tina.
Thank you. Ринат Құдайбергенов, баяндамаңызға рахмет. Қызықты баяндама.
Thank you very much for your speech. I have the question. So, talking about advanced training of nurses, you said that nurses should go through the advanced training courses. You focused on management and psychology. The patients should not only be treated, but they should be cared for. Thank you very much.
Келесі баяндамасымен Диана Кеңесбек.
The next speaker is Diana Kenesbek, the second-year master students, South Kazakhstan Medical Academy from Shymkent. She's going to be talking about characteristics of the communication system for nursing care for patients with intestinal stomy. I'm going to talk about characteristics of the nursing care for patients with intestinal stomy. Currently, there is a growing number of patients with intestinal stomy. In some regions, 0.05% of the population is diagnosed with this disease. Most of the intestinal stomy are provoked with the intestinal cancer or ulcers or traumas. These people consider themselves as permanently ill. They do not value themselves as like as an individual. They consider themselves as weak persons. So nurses should have the abilities to help psychologically the problems of these persons. And we've carried out the study and applied interviewing. As for materials of the study, this is the unit of intestinal disease in the regional hospital, surgical hospital. We've carried out interviews with patients. The general recommendations were given. 60 patients participated in this study. So we carried out these close interviews. The questions were the following: when the patients, when you were in hospital, did nurses treat you in a respectful way? So this is one of the questions. Here we studied the level of satisfaction of patients with stomae. We assessed the assessment of the quality of nursing care. We've carried out questioning. And we found out that the patients are not quite satisfied with the work of nurses. However, they need assistance of nurses, psychological assistance. So what were the recommendations? To upgrade the skills of nurses in the department where they treat intestinal stoma, where they treat intestinal diseases, and there were recommendations given to improve the work of nurses in the inpatient departments. We also asked a question about the life standards of the patients after they are discharged from hospitals. And we also drafted or designed the scripts of communication with the patients with intestinal stoma. So we showed nurses how to talk to them so that the patients could understand how to live their life further. Thank you very much. Thank you very much. There are questions. Please. My name is Imana Mangildivna. I represent Atrao from cardio surgery department. So I have a question on the diagnosis. Where did you take statistics from? Approximately. You told that there are patients with intestinal stoma after oncological disease or after surgery who should have provided care for these patients. So the patients with stoma are divided into two categories. The first one with closed stoma and the second one with an open stoma. And so they require lifelong care. Stoma may be temporary or constant. The temporary one can be applied to the patient intestinal tract, and During interviews, I found out that they're a bit ashamed of themselves. They need to get care after being discharged from hospitals. I think the nurse should explain them how to live further. This should be a nurse from the inpatient department in their own district. And in this case, nurses in the polyclinics, local polyclinics, should explain patients with intestinal stoma how to live with it, how to maintain it further. In my family, there was one relative with intestinal stoma, and the government should, I would like to say that the government should provide all the medical devices to this patient. So we need statistics of the number of such patients, and thus we'll understand how many patients need counseling. Thank you very much. My name is Nursalu Sabai. I am from the Central Hospital. So I would like to say, I don't want to say about chief nurses, senior nurses, those who are with academic disease. Please stand up. Those who are nurses, simple nurse. I'm very sad. The name of the conference doesn't correspond with what we are talking about, because it's not about Trinity. It's not. Clinical practice is absent here. I'm the only practicing nurse here in this room visiting this conference. I want to be involved in research. I would like to introduce novelties in nursing, in science. Thank you very much for your comment, but the invitations were sent to all the medical departments. After lunch, we have a round table. Let's raise this issue again. Don't forget that this section is about young scientists, young researchers. Let's just close this section. And as for the organizational issues, we'll leave them for the session after lunch. And I have another question. It's about further growth, career path, like admission to master's course. If you all cooperate between each other, I would like to ask you to follow the practice of Nazarbayev universities. They actually help the practicing nurses to enter their courses. They help them with higher mathematics, which is not needed at our job. It's about, I mean that we have forgotten the math rules and after we graduated from school. So they help us with this. They make bit kind of discounts, and training at Nazarbayev University were 2 best years of my life. Please replicate their practice. What I wanted to say more. Thank you very much. We've heard you. We are all limited by the regulations, by legislative framework. This is a good question for the after lunch session. There will be those participants after lunch who draft these documents for us and for you. And comment number 3. Yesterday, when I told about English, I didn't mean English as it is. I told you that Nazarbayev University carries out studies in English, but they've made such a discount to us, they provided us with simultaneous interpreting. I understand English, but I don't speak a lot in English, so that's why I cannot explain me. As for the fact that I'm wearing a scarf, it doesn't mean that I don't want to study. It means that I am Kazakh. I have Kazakh ethnicity. Please don't interrupt me. It's this symbol of my ethnic belonging. Yes, it's the choice of everyone. Dear participants of the conference, allow me to close this section, science and research in the field of nursing, young researchers. Thank you.
Yes. Yes. No.
Perusa had a question.
No, she don't have.
Okay.
Do you want to say something for our guests or participants?
Thank you all for this great session, and we welcome you again at 2 o'clock in the afternoon for the roundtable discussion. Thank you.
Уважаемые участники, встречаемся в 2 часа на круглом столе.
Dear participants, see you at 2.
Раз, два, три. Один, два, три. Раз. Раз, два, три. Эй, 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 эй. Один, два, три. Один, два, три. Раз, два, три. Раз. Один, два, три, четыре, пять, шесть, семь. Один, два, три. Один, два, три, четыре, пять, шесть, семь. Один, два, три. Один, два, три. Один, два. Один, два, три, четыре, пять, шесть, семь. Один, два, три. Один, два, три, четыре, пять, шесть, семь. Один, два, три. Один, два, три. Один, два, три. Теперь сами они не будут слышать сам круглый стол, вопросов в зал плохо будет слышать. Попробуй поднять немножко фейдер. 1, 2, 3, 4, 5, 6, 7. Ага, вот так примерно. Хотя бы так. Потому что у них мониторинг не работает. Вот эти напольные мониторы, они отключены. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. Мониторы звуковые. Да нет. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. Ну так, наверное, получше будет там слышно. Хорошо.
Recording in progress.
Ага, участники круглого стола, пожалуйста, проходите заниматься. Уважаемые
So, distinguished participants of the conference, so now we'll start. As for the program, we have planned a roundtable on sustainability of implementation of the project results. So now I would like to introduce the participants of the roundtable. So we're here, the stakeholders, the colleges, the university representatives, and the practitioners, as well as the association, NGO members, and the representatives of the Ministry of Public Health. Nazira Usenova-Julzhanova, she is the head of the Nursing Development Department, Department of Science and Human Resources. Ainagul Nauruzbaeva, Chief Expert of the Nursing Development Department of the Department of Science and Human Resources. Zhivile Kenjinsky, Project AccelEd Manager, International Program Coordinator, International Relations and Studies Center at Lithuanian University of Medical Science, Lithuania. Aurelia, another excellent project, same Lithuanian University of Medical Sciences. Bourjano Markulov, he is the director of the Institute of Public Health and Professional Health, Karaganda Medical University. Aizat Sidakhmetova, head of the Department of Emergency Medicine and Nursing, South Kazakhstan Medical Academy. Paolo Kolet, Assistant Professor, School of Medicine, Nazarbayev University. Dinara Makhambitkulova, head of the Department of Nursing of Asfendiarova Kazakh National Medical University, Kazakhstan. Ayjan Bentuganova, Assistant of the Nursing Department, Astana Medical University. Today she's our speaker. Janar Shalkarova, General Director of the Multidisciplinary Higher College, Turkestan, Kazakhstan. Jarkambay Rumsakov, Director of the Higher Medical College, Astana. Naila Ruzdenova, Director of the National Higher Medical College, Almaty. Gulnur Nadirbekova, Director of Nursing, University Medical Center, Astana. So as I understand, you will represent her. Yes. Hello, my name is Dinara. I am the Deputy Director of Nursing, head of the Department of the Development of Nursing. Jamila Zainulina, Manager of the Department of Management and Development of Nursing, National Cancer Research Center, Astana. Kulziya Bienova, you know her, the chief nurse of the polyclinic number 5 of Astana. As you may see, the composition of the participants is different representatives. And before the start, we would like to have the form of discussions with the involvement of participants. It will be the format of questions and answers. And before we start the discussions, I would like to give the floor to Ayjan Nurjanovna Baytuganova. I would like to speak a bit about her. She is the example. She graduated a bachelor course in at our university, ranked a BEd. She has experience, then entered a master course University Astana, and this year a PhD on nursing. She is the first year student of PhD program, so she is the active participant of the program, has very good knowledge of English language, and she will now report the results to ensure the sustainability of the project results. Please, the floor is yours. Thank you very much, Zuriel Panna. Hello, distinguished experts of the round table, distinguished participants of the conference. Let me introduce my report about the successful achievement of the project results. So, as background information, I was the participant of AccelEd project, and in the package of dissemination of the results, which included the sustainability of the results of the project, which I would like to report. So, what is the presentation about? First of all, I would like to mention the results which have been achieved in the framework of this project. In particular, that's the reports, the recommendations, and guidance, which were in the framework of the working packages. First day, I believe you heard the reports, of the other speakers about the packages and the results achieved. On this slide, you can see the name of the report, which was implemented during the project. It's about the experience, the recommendations, service design, the facilitation methods for the development of nursing services in Kazakhstan. To be brief, we recommend as project participants and members in the healthcare institutions and medical universities to implement this approach. This report was published on the website, official website of the project. So you can see the QR code on this slide, which you can use and get detailed information of the report. The report is quite big and very useful both for practitioners and for the universities. I would like to give the details of this report. As a result of this report, we would like to introduce service design in the syllabus of the universities to involve nurses from the practical point of view to develop joint projects. So essentially, that's the logical justification, because with the practitioners, with the practical medicine and without the nurses, not any project is possible. To organize lifelong education for the medical suppliers, nurses, and other professionals. Within 3 years, the working package 2-3, with the support of Young's Finland University and Karaganda University, there were an action plan implemented for this service design approach. Further, you can see the table. And we assume that the sectors which were, the targeted audience are the medical universities, health institutions, associations, which can be involved and can further facilitate, after the project, the sustainable development of the results. In other words, to apply this in practice, these results. Next report is the cooperation in nursing development in Kazakhstan. So here, there is a need to have support from the Ministry of Education of Kazakhstan, Ministry of Healthcare of Kazakhstan, universities, which in the universities, these are the nursing schools, research centers, medical, healthcare institutions. So that's what we mean, first of all, the chief nurses, chief doctors, senior nurses who will be interested to apply the results of this project and reports and further disseminate in practice, and as well as the associations and funds. In this report, we suggest to increase the number of scholarships, participate in research cooperation together for teachers and nurses, support the cooperation between the medical institutions and the healthcare institutions, medical universities, healthcare institutions, and further develop the nursing education in Kazakhstan. And the official cooperation with the local government or with the primary healthcare institutions. And next report is the recommendations as a result of the master and PhD education nursing thesis. Here, there is a need to have support of the universities, of ministries, who will further adopt these recommendations. In accordance with this report, we recommend to increase the number of scholarships for MA, bachelor, and PhD education. So we discussed for 2 days the opportunities for nurses to continue education, to ensure lifelong education for nurses. Next is the boards, the advisory boards on review of the theses. Here we mean the MA students or MA graduates and their works. The results of their work shall be assessed by the nurses, the practitioners, those who have MA level or sometimes PhD level. So here we expect the first graduates on the nursing education and science, and in the future we hope that these boards will consist of more people with the PhD. In this report, it says that there is a need to have international cooperation as well. So joining the international associations, NGOs, strengthening the regional NGOs or the municipal ones. Next, the report on the assessment of the MA and PhD theses on nursing education and in general. So to ensure sustainability of these results, we need to adopt the guidelines in the medical universities, draft the policy in each university, how to use these guidelines, and involve the experts with the PhD in assessment of master or PhD dissertations or theses. So that's something I mentioned earlier. The key role here is taken by the ministries, schools of nurses, nursing education. Now, I would like to present, and it was mentioned by the previous speaker that based on Karaganda Medical University, there was GBI center established. GBI is focused on the systematic analysis methods and the data integration. Center is working on ensuring sustainability between the medical higher educations, universities, and the healthcare institutions based on the evidence-based approach. To ensure the sustainability of this center, there is a need to ensure funding, resources for the development of this center. And all the universities of Kazakhstan have assigned the responsible stakeholders, those who participate and help to develop this center. Further on, the key role will be given to the medical universities, associations, NGOs, and foundations. Next is Atlas TI software. This software was mentioned earlier. This is the software which helps to ensure qualitative research in nursing education. As of today, the medical universities of Kazakhstan have purchased this software, and they have the departments, faculties have access to this software, and the students of MA course or PhD course can use this software and ensure qualitative research. The repositories, that's in general the e-platform or e-database to store the data of the organizations or academic research results. Here, there is a need to ensure support from the medical universities, which will help this repository to be further developed, or the database will be updated. As a result, that's all. I wanted to be brief in explaining the results. Further, we would like to draft the plan, and this plan will be finalized, and it will summarize what will be the next steps to ensure the sustainability of the project outcomes. On this slide, additionally, I would like to show our website. So as a result of the project, the study materials are the results of the project. You can use these materials. They are in free access. Of course, we'll add in the nearest time the additional material. So these training materials have been drafted in the framework of master classes or seminars, workshops, by local representatives and the international experts of the medical universities. So you can use these materials. Literature. So there is another literature on the service design. So if, for example, you want to establish service in your departments, you can use this literature. In case you have any questions, feel free to contact me. The contacts are available on the website, as well as in brochures, which you have most likely received when registering to this presentation. Here are the QR codes on our official webpage. Thank you very much for your attention. So, any questions or comments? Can you please again demonstrate the slide with the QR code? Thank you very much, Ayjan Nurjanovna. So, distinguished colleagues, now we'll have the format of discussions when I will give the floor to the participants of the round table. And after the presentation, in case you have questions, you can use the microphone and ask the question. So you are listening for 2 days, and yesterday and today there were reports about the results of implementation, but on different levels. Today we had the section on young researchers, short lectures. Both days on different levels, the implementation on the institutional, on the individual level, on the level of society, on the level of higher education. So now I'd like to give the floor to Nazira Usenovna, head of the Department of Development of Nursing Education, and your vision of further sustainable development of the results of the project. The floor is yours. Hello, distinguished participants. I would like to welcome all of you at this event, at this conference, which is aimed at development of nursing in Kazakhstan. hopefully you had a fruitful 2 days of work, and everyone has some takeaways out of these 2 days. So what was the question? The question is, on behalf of the Ministry of Public Health in the field of development of nursing, I know that there is the drafting of the concept of the nursing until 2026. So how the works are going on here, and as for the occupational standard, so these 2 documents, on which stage of development or drafting of these 2 documents. So before we have approved and enacted the 3 unit of nursing roadmap, and it's ended up this year. The first development is that the working group, together with the practitioners, education institutions and experts, we have drafted the concept of the development of nursing until 2026. As of today, it's still a draft. We will approve with the Ministry of Public Health, maybe further on with the other government bodies. If there are any proposals, you can send, because the document is still being discussed. It's not yet approved. As for the occupational standard, the Ministry of Labor has drafted the new project on the occupational standards. Once we launched our project of occupational standard sent to the Ministry of Justice, as of now we publish on the web portal of the Ministry of Labor, and further we'll send to the government bodies for approval. So it's still also the draft document. So if any questions, there can be various questions you can ask. As for the regulations or payment system, you can ask these questions.
Очень приятно, Назира.
It's a pleasure, Nazira, to see you. You know, Kazakhstan is a benchmark for Asian countries, Central Asian countries, and the rest, Central Asian countries, follow you with respect to your practice in nursing, your reforms in nursing, and both the European and Central Asian countries and the United States, they're talking about lack of nurses. How do you, so what kind of solutions do you see in this case? How to support young people getting education in nursing? A speaker from the previous session said that we should be ambassadors of the profession, the nurses. But how does the ministry see this? Thank you very much, Aurelia, for this question. Yes, jointly with WHO, we visit different Central Asian countries, and each country presents its experience to the rest. With the help of, we promoted education in nursing thanks to this project, to Finland, to Lithuania, and within the recent decades, we've improved education, and we started to train nurses on the master and PhD levels. In Kazakhstan, there are about 180,000 graduates every, specialists who are nurses, like we call them vacation education training graduates. And there are 2 nurses per 1 doctor, and further for them to be motivated. Their salary was raised. The general nurse, who is a college graduate, gets the salary of 160,000. If she graduated from the applied bachelor course, she had the salary of 200,000 tenge. Then they study on other levels like master degree and PhD. In southern regions, we have surplus of, so to say, of nurses and deficit of nurses in the north. And we propose people from the south to go to the north to explain them that what kind of payments they have to expect. Currently, the deficit is 4,000 nurses, like as compared to doctors, and there is a deficit of doctors. We lack 7,000 doctors. Recently, they were talking about the issue of grading of nurses. Do you think this will raise the prestige of a nurse or not? In reality, if we return the categories, the nurses will not have motivation to be educated further. I wanted to ask whether this issue is being considered in the ministry or not. Thank you. As for qualification grading, it's not only about the nurses but doctors as well. That order is not valid anymore, and that's why many healthcare professionals lost extra pay or kind of bonus to their salary. And there were a lot of complaints. Last year and the year before, there is a agreement between the trade unions and the Ministry of Health. Based upon that agreement, these people are paid this like margin. And currently, this grading is called the qualification level. And next year, there will be a corresponding order approved by the ministry, and the levels of qualification will be approved, and not the levels of grading or how they were called categories in Soviet times. But you were right with respect to motivation. In nursing, if you have a higher level of education, then you get better pay. But we will return the notion of qualification level, and this order will be amended. Probably this additional payment for qualification level will be made through the public service platform of e-government. Why I ask these questions? Because from the experience of UMC hospital, the payment is done according to this career ladder or path, and we are closely cooperating with our Finnish colleagues, where we developed that career path for the nurses of extended practice, general practice, and according to our experience, the nurses with that category, with that grade, they're not motivated to develop anymore. Their career path or career ladder showed that each nurse may identify on which step they are and towards which course she may grow. And their salary grows correspondingly depending on their competence, depending on their plans to grow. This creates motivation for nurses to professionally grow and thus to earn more. A lot has been said about research done by nurses, and there was a remark that nurses are not very proactive in research activities. The career ladder, upon the experience of our hospital, gave some impetus for nurses to participate in research. They see that the more they are involved in all these processes, the more they grow professionally from career standpoint, and the more motivated they are to be trained further. Many nurses are currently studying at the universities of Kazakhstan and of other countries. They're very motivated and to grow professionally. At least there is budget envisaged. Sometimes the hospitals decide whether to pay this additional pay or not, but the money is there, and those who received that extra pay before based upon their categories, that they will get this payment. And those who don't have any categories of this qualification may be assigned to them depending on the qualification. The real panel maybe will include this issue into the resolution, and then we'll monitor it closely. I mean that currently the qualification categories, that the payment for qualification category is paid upon the agreement between the trade union and the ministry, but some hospitals don't do this. And since we are going to introduce amendments to the order on this extra pay for the nurses on all levels of education, I think this should be mentioned in the resolution of this conference and sent to the ministry. I would like to ask a question. We are concerned with the following. This, like, okay, the nurses get these categories as they were called before, and they won't be incentivized to study further. Although there were a lot of efforts put into creating those master, PhD degree courses. So we are worried whether this categorization will be a barrier for them to study further. I don't think so. If qualification categories will be restored, you mean that the nurses will think, why I need the further education, right? But there is a state order for grants, and if there is a demand for nurses with the high education in the specific region, then the ministry allocates money. This is a very urgent topic. UM's experience is very is remarkable, but we should be very careful here. We'll have different funds and sources of funding, and on municipal level, on the regional level, on the national level. Your experience is good, but whether we'll be able to replicate this experience to all the regions of Kazakhstan, that's a question. So be very thorough in introducing this mechanism, because it depends on the funding sources. And Zira Fenovna, I would like to ask a question about grants. How do you distribute grants for training nurses on different levels of education. So we're distributing grants depending on the needs of the regions, and we are guided by the rules of education or education ministry or the Ministry of Enlightenment. There is another one. So we send a request to the regional health department. They reply to us and they say there is not a lot of need with respect to nursing courses. We've been talking a long period of time about need of bachelor degree for nurses and all over Kazakhstan. And there is only 1, 2, or 3 students in one group in 1 year. So we have 6, 7 universities, and the barely will be about 20 students. This program is not profitable. An education program is under the threat. You should increase the grants for academic bachelor course for years. If we do not have academic bachelor, we will lack the pool of those who would like to enter the master course. And if we don't have a master course students, there will be no teachers, there will be no candidates for PhD course, and the nursing will die out in the country. That's the merry note to continue. Let me respond to what you were talking about, categories. 20 years ago, we started to talk with the holding about the categories. When they came to Lithuania, they came to us with categories, then left without categories and entered bachelor course and master course. 33 years ago, we had categories. And if you believe us, we rejected this system, and we are glad, because this is not related to any progress at all. Progress is related to education only, and to the resources a person would like to invest in themselves. If I want to be a nurse assistant, I will continue to do this. If I want to be an academic bachelor degree, I will enter this course. If I don't want, I go to the college level. So, as per abilities of the person, it's good that you have included in your legislation the difference in salaries depending on the education. That's a success, because Lithuania had to spend 20 years to gain this. In all the hospitals, different levels of specialists are needed, and that's why they have different salaries. If there is a university hospital like NUSOM or holding, they are independent. They follow their orders, but they have their own rules, and internally they may establish other salaries according to another scheme of remuneration than in PHC, like primary, secondary healthcare, depending on the levels of services. And it's great that this exists, because one hospital uses gamma knife for neurological operation, surgery, and other doctors in another hospital, they just listen to the beat of your heart. So different skills are needed, and different qualifications should be paid for in a different way. Please don't move backwards with respect to these categories. We refused from the categories, and we are very glad. And really, thank you very much. I would like to add what my colleague has mentioned, and to answer some of the questions. I support really your words, your opinion. As Nazira Huseynovna has mentioned, we determine salary based upon qualification, and that issues UMC raises with respect to that career trajectory in UMC. It would be great to apply it in all healthcare institutions. We should remember that there are state-owned hospitals, and the remuneration scheme is determined by the administration. Of course, it would be great to introduce the UMC experience in some of state-owned hospitals to check to what extent the salary can be changed. And I would like to thank the all the participants for participation. But let's not forget about higher medical colleges. That nurse, which starts from colleges and goes to the bachelor degree, master degree, and PhD, and those moving from one stage to another in education, these professionals should understand that they will not only get education and but a higher pay, but the prestige of the profession is going to be higher. So the question of grant, those organizations which launched applications, so it depends on them how many grants will be allocated. Like, for example, a healthcare institution sends an application to the healthcare ministry, like we need 10 nurses, another hospital needs 15 nurses, and then we will aggregate these applications and I agree 20 grants are not enough. We should start from the hospitals. They should lodge application to the ministry. Annually, about 3,000–4,000 nurses graduate from the colleges. Agree? They should go further, and further their education is paid. And there are no grants on academic bachelor level. Yes, this issue should be raised. So the question about grants, so the hospitals should send an application for the number of nurses they need. But how do you split them into different categories, like qualification levels? Do you ask them what kind of nurses do they need, like college graduates, applied bachelor, academic bachelor, or it's just an application for the nurses and without specification? Based upon the recent research in Kazakhstan, there is a lack of nurses with academic bachelor degree, and that's why they choose short academic programs. They train on them. In our university, we have 500 students, and because the students enter our university, this program is in demand in the country. But why don't you allocate grants for the academic bachelor degree and don't make them go to the colleges, then applied bachelor course? Why do you make their life difficult? If they want to enter bachelor, academic bachelor course, every nurse with the college degree wants to enter the academic bachelor course. There are many brief programs, but for them no grants are allocated.
Касательно уровня образования.
As for the education level, technical, professional, academic, why academic bachelor is not chosen by anyone, and there is a reduced form of education. The medical universities, they have to send the draft curricula or education program. The Medical University Astana has proposed and further will consider. As for the academic bachelor course, as of today, most specialists who work in education, in healthcare institutions, they have to study online, but in Kazakhstan we don't have online education. Why we have a big demand in academic bachelor because they study online in other countries of CIS, since it's cheaper or requirements are less strict, as we've heard yesterday, and most people have problems with English language. So. And currently we have a list of specializations which is about certification. All medical staff has to pass certification in order to get access to the work. Second article there, the level of post-secondary education, it's the nurse of expanded practice. So why we have this name or title? Because this position can be occupied by the nurses after the academic bachelor course, and except this they can work as managers and teach. If they go to the practical healthcare, except the remote education, how can we identify this? There is a department and committees of the medical and pharmaceutical control receive applications. Those who studied in Russia, for example, they the student has to provide the confirmation of the document. Sometimes the department denies, rejects because it's online education, or our Department of Nursing, we consider this application first sent to the healthcare institution or education institution whether the student really studied there and how many hours. If they confirm, this education institution sometimes we request documents. If everything is confirmed, then the specialist will receive certificate. So this year we have introduced the following changes in this decree, so that our medical universities will be popular in terms of the course of academic bachelor. So it means that this is relevant, the program of academic bachelor. Why then there is no scholarships? Firuza, this is the parallel question. I have another question. It's like a continuation or comment of your speech. Thank you very much for the answer. Now we discuss, as Azada said, about 4 years program which are not profitable. In every university, before we had one person in the group and it was not profitable at all. So there was a issue on agenda to close these programs. A big demand on the reduced program, 10 months or 2.5 years for the practitioners, nurses. We organized evening courses, and these programs are in a big demand. The issue in agenda is for 4 years programs, 20 scholarships for all the universities is little, it's not that many. So the question is whether you consider to allocate additional scholarships for the programs 10 months and 2.5 years after applied a bachelor course, since they are in demand. So then I believe that the salaries of the nurses, not like the salaries of the doctors. And we'll have bigger groups. And the more we have academic bachelors, and the more we'll have students in the MA course. And of course, thus we will enhance the capacity, build the capacity of this in this profession. So do you have any plans in this regard to increase the scholarships? So actually, that's the issue which cannot be tackled in 1 minute. So the program, the reduced one, which you offer for 10 months, as a 10 months program, if you offer the open form of education, then the requirements maybe will be reduced. This education program shall be reduced by the expert group, by the focus group, shall be discussed by all stakeholders and the level of after academic bachelor, and then after the discussions we can have one decision. I have one remark. I'm the teacher of the reduced education programs on academic applied bachelor, and when we ask question, why do you study here? They don't have a purpose to be a researcher in nursing. If we want to receive researchers in nursing, then we have to allocate scholarships for 4 years program, because the students of MA and PhD are the graduates of the 4 years program of academic bachelor course. I have another question. This question is important for us, and sorry for asking so many questions. There is a requirement when entering MA or PhD, IELTS requirement 5.5, MA 6 or 6.5 scores. So why the requirements on IELTS are higher for MA course and less for PhD course? Can you explain this difference? The requirements for students students of MA PhD course, PhD 5.5, MA course requirements 6.5. Why the requirement for the language level for MA is higher than in PhD? I think that's the requirements of the Ministry of Education. That's the Ministry of Education decree. Then I think this issue will be asked at the other conference. Okay. There was a question on human resources. When I prepared the report, I analyzed the requirements of the market in training the academic bachelors countrywide, and I asked the report of the HR, and the report as of 2023, the need or demand about 3,000 and only 45 in Astana city. So there are a big demand in this resources, and there is a big demand in MA students in nursing, and there is a breakdown by regions. Another issue, who gives this application? That's the healthcare institutions, and perhaps they receive from the ministries of the Ministry of Healthcare. So they send the request what kind of specialists they need. For example, here we have the practitioners, nurses, who replied to this application, HR department, or who identified this need. Do they have the gradation by level? For example, I need the nurse after college, or I need the nurse after expanded practice, with expanded practice, or I need the nurse with a university degree. So can you tell me, please, how this application is being drafted by your manager? It's unclear. What I'm trying to say, the need in training the academic bachelor and MA students in nursing is there. Bahit Kasimova, Pavlodar Higher Medical College. Ladies and gentlemen, Presidium members, I would like to say that this year the Trinity of the nursing roadmap is ended up. So the program was implemented, the Trinity of Nursing roadmap, and I believe that next year will be new actions plan, new roadmap, and to ensure the better quality of the nursing education, we need to include the items so that this issue will be worked out in detail. So the nursing in bachelor, in MA, in PhD course to be priority, because the medical higher colleges, higher education colleges need the academic bachelor's, MA students and PhD students. So that's the wishes from my side. I have the question to Nazira Usyanovna. So there is a problem, and it's about the problem for the national clinics, because the graduates of the medical colleges, Astana is growing, and the healthcare institutions, there are a lot of them opening, as well as national ones, but there are problems with the HR, because the colleges are mainly sending students, graduates to the government healthcare institutions. So the problem with HR. So the graduates of the medical colleges, either from the private one or taking the positions. And the question on agenda, how to ensure the human resources, because the new clinics are opened, the government ones are opened, the private ones are opened, how to ensure the adequate number of nurses in the clinics, both government or private, because we understand that we speak about different level nurses, general, applied bachelor, PhD, MA, but the problem is in national clinics that there is lack of nurses of general profile, general practitioners. Thank you very much for the question. In the framework of legislation, Akimat, the local authorities, are responsible for the human resources in their regions. So, in other words, you send to the local government that you need this stuff, and they have to ensure it's based on the code, on the health of population. But you can make a contract with the private college and pay for 3 years, for example. How many students in 50, 100? And you can pay for the education, and then you can, of course, have them. But you don't want to invest. Hello, my name is Asiya Pavlodar. I represent education, and I'm one of the senior nurse of the clinics in Pavlodar and work in Pavlodar College, Medical College. As for the applications for scholarships, which was discussed now, maybe we need a person who will be the bridge between the Department of Healthcare of the regions and the healthcare institutions. Because very often the Department of Healthcare sends information to the healthcare institutions on what kind of nurses you have, the applied, bachelor, academic in the fields. Since the nurses and senior nurses are very busy, they just give number, but actually there is no person who in the region will do analytics on the number of the nurses, academic, bachelor, MMA, PhD, and this person will provide this application and be the bridge between the healthcare institutions, who will give trainings, master classes, seminars, and the information which we've had within these 2 days will deliver, convey in the field to each clinics, to each hospitals, and it will be wonderful. Another wish, within these 2 years, we have received a lot of useful information, and we'd like to have some single database, because all clinics, some of them are limited liability companies, some of them are different forms of their entities, and they all cannot buy access to the database, and it means that nurses do not have an opportunity to receive information and to do this work. If it will be a free of charge platform or database where we'll receive information, that will be wonderful. Thank you very much, Asiya. I would like to answer this question. In Kazakhstan, we have the Coordination Council on the nursing, which includes the outsourcing specialists from each region. So, and they're both from the education institution, from the healthcare institution, and this person can provide statistics which you mentioned now, and our department of nursing works with this person. Here we have from Pavlodar region, Bakhtgul is coordinator. Do we have any other coordinators from other regions? I would like to clarify if coordinators on nursing can be, maybe they are like outsourcing staff in other regions. Maybe they shall be removed, the other duties shall be removed from their job description. Coordinators, they still continue to work as the senior nurses or in colleges. We have another North Kazakhstan region representative, Pavlodar region. Yesterday we had from Turkestan and Shymkent. Not all coordinators are here, but still the work is going on, and we'll strengthen this work in terms of the applications collections for the grants, for the scholarships. And in the resolution we shall specify this item. Hello, National Research Center of the Healthcare. Thank you very much to the organizers for this wonderful conference. And here we have raised the issues. On each level, we have to think through the following. Number one, the applications. How do these applications are drafted? The Ministry of Education has done a lot of work on the improvement of regulations. Department of HR has drafted the competencies for the nurses, and this information is available. The standards have been improved of the primary health care, of the care in hospitals, where everything is specified. What is the functions, job descriptions of the nurse? What is the job description of the academic bachelor nurse or MA nurse? So here we'd like to invite all the clinics to read these regulations, the standards, and further describe everything in their processes. If we say in healthcare, in primary healthcare institution, there shall be independent nursing work. I mean, there shall not be 12 patients in one, let's say, shift, but 8, but 2 or 3 times more patients per shift, because this additional work is done by the nurses of expanded practice. So you have to describe your need. So recently we had the WHO conference on primary health care, and the number 3 priority is strengthen the nursing. And the task is, thanks to this nursing, to increase the coverage by the coverage of the healthcare services. So, and the figure which we shall strive for is 80. So, and the focus is done on the nursing. And the clinic shall tell that with the improvement of the process to provide the services to the patients, the nurses shall have new skills and competences. And we come to the medical colleges, that medical colleges shall enhance the curricula on training the skills and competences. I mean, when our nurses will have an opportunity to reload the doctor. I mean, when we say the doctor on the level of primary healthcare has 15 minutes per one patient, now we want to reduce this number, so that there will be about 25-30 patients in one site, so that the nurses will diagnose as well, but the doctor will give only the recommendations, valuable recommendations, because the education of doctor is valuable. We spent much money for educating doctor, and to compare the grant for college and training at the university is quite a big difference here. And the competences which are specified in new standards are quite feasible. If our nurses will obtain these competences at college. So the general practitioners, about 40% functions of the general practitioners shall be delegated to the nurses. Unfortunately, in the feedback, they said, we can't, because our nurses do not have these competences. We can't rely on nurses in most issues, and in terms of diagnosis. And that's, I would say, there is a justification of this, because we speak about the correct application. Thank you very much for information. Thank you.
I would like to give the floor to Janara Batbekovna. She's the expert in nursing. She coordinated the work in professional standard development, the concept which is being discussed right now. Janara Batbekovna, could you please comment on the issue of functions, categories, tariffs? Thank you very much, dear colleagues, for the opportunity to participate in this conference. I've been listening to the speeches for today's, and I have some ideas about the concept of the nursing reform, where we are going to, and I have two insights. The first one is that we discussed today the nurses on different levels. We raised the issue of the need in grants, raised the issue of the need in nurses on different levels, like college, bachelor, master, PhD. So we're talking about different level nurses, and we think how many of them we need. And another insight is that the official demand is very low in nurses. I'm talking about official one, and that's why researchers at the conference mentioned that the real need in nurses is high, but official figures are very low. So hence there are no grants and so on and so forth. So we are in a kind of an informational gap. And these are the figures, and the situation which we have right now should be considered from another angle. There is no official demand because there is no official supply because there is no official demand. So, and this is the stage of many countries when the nurses from the level of the assistant nurse becomes a specialist in nursing. So all the countries have gone through these stages, and I would like to mention that the main value of AccelEd projects, which we'll be discussing for 2 days, and I think that this project is very important for Kazakhstan, and we're talking about sustainability of this project. This project gives the main value, creating theory and a basis. There is medicine and there is nursing, and there are different things. They're based upon different concepts, they're based upon different needs. And the challenge of Kazakhstan, as any other country on the stage of transition, is that actually we have the market of medical services, which is the derivative of the demand for health, but there is no demand in nursing services, and the final consumer understands that we can have good health through medical services, and that's why they create demand for doctors and nurses, and they don't understand that in parallel they can get healthy lifestyles through using the services of nurses. And the idea of AccelEd is what we should discuss. If we talk about the market of health care services, so the market has information asymmetry. A doctor is the patient's agent because the patient doesn't know which services they need, and doctor guide them through the whole system. The doctor diagnoses the patient, and the patient trusts the doctor, and there is no nurse which could be the patient's agent too, because the patient doesn't know which nursing services they may receive. The nurse may carry out diagnostics, explain what the patient needs. That's a classical approach. We say that the doctor should be the patient's agent and the nurse too. Why? It's because patient has a lower level of information, of awareness. Yeah, they don't know anything about their health status. And I think that in our country, as well as other countries which have the same experience, there is another information asymmetry or gap, which is between the doctor and the nurse. These are two economic entities, so to say, and the doctor doesn't know what could be the functions of a nurse, complete functions of a nurse. They know their job description, but they don't know what could be the job description of a nurse. And actually, we can state that the nurse should be the agent of a doctor, and the chief nurse is the agent of the chief doctor. And currently, the doctors are less informed, less aware about the nurse role. AccelEd is a unique project, I would like to reiterate, because it gives the opportunity to distinguish between this concept. It shows these things. It gives a lot of tools and gives us a lot of research field. And some of the researchers who know the methodology of field researchers, they have very good quality of research. And when we talk about the needs, we are talking as a result about funding, because this applies to medical services and doctors usually, and all the tariffs we have right now are the tariffs of the costs in medical services, and the nurses' labor is the cost center. And actually, the nurse, according to these tariffs, helps doctor to provide medical services. And until every chief doctor, each CFO of health institutions understand that they have to change the cost structure and the service structure, nothing will change. Because in the range of services the hospital provides, not only medical services, but nursing services should be involved. So there is an urgent need to change the tariffs of the services. The administration of hospitals understand that money equals doctors' services, but they should understand that money equals nurses' services as well. And if you go even deeper, and I'm very grateful for the presentations of the results of the WV on service design, this is what the medical institutions need. They have to change the service structure and introduce nursing structure. They should calculate the tariffs, do the business process reengineering, use the service design way of thinking. So econometric calculations should be here. But there is one but. In the conditions of the mandatory medical insurance system and free of charge services system, this system of insurance in Kazakhstan is a planned system of distribution of funds. And when there is a planned thing, element, there is a competitiveness of supplier and a autonomous nature of suppliers of medical services. It means that if the driver nursing services development in Kazakhstan is competitiveness and independence of supplies in this spectrum of services they should provide. And hence this leads to other things. We should include tariffs for independent nursing services. Plus, we should think about splitting the functions of providing medical help, financing of medical help, and supervision of medical health, and so there should be 3 different levels, not one body, one authority. We should think about competitiveness of insurance authorities. Currently, the package of services under the mandatory insurance is quite vague. We should extend the choice of services for the patients. As in research, there is a mix of qualitative and quantitative services. Here, each organization may provide a unique mix of doctoral and nursing services, and the tariffs and the system of insurance will change. And when we achieve competitiveness and independence of supplies, this will become a driver of wider nursing services. So we should provide financial platform and then conditions for the work. And then there will be need for nurses on different levels of management, and the official number of grants should be increased. Thank you. Thank you very much, Nara. This is a whole course. Very interesting. Please.
So I need to close this and put this down. I just have one comment, and I am so sorry to change the topic from your discussion. We educate nurses and healthcare professionals to serve the patient's needs in all our countries. And in 2010, it was recommended to have 80% of nursing staff, Bachelor of Science degree, on the clinical departments, for example. And the studies of Linda Aiken have a long time ago shown that if we have more bachelor-educated nurses on the clinical wards and they present the precise numbers that we need, it lowers mortality on the wards. So bearing this in mind, we conducted a small survey in AccelEd when starting this project, how many graduates there are in the Kazakhstan universities in bachelor, master, and PhD, and in the European universities, bachelor, masters, and PhD. There is absolutely shocking difference between the numbers and the percentage of the numbers of bachelor-educated nurses from Kazakhstan, in Kazakhstan universities, as compared to European universities in this project only. And I am coming from the Netherlands. I am from Iceland, but coming from the Netherlands, and we have a population similar to Kazakhstan population, 18 million approximately. I don't have the exact number. I was trying to find it online now, but I didn't have internet access. But I can assure you we graduate thousands of bachelor nurses for the clinical departments, for all the arenas where nurses are working in clinical health care, and we educate approximately 100 nurses with master's degree, 50 to 100 with master's degree. And I can assure you that there are 20, 30 nurses having their degree, PhD degree every year. We were not here 30 years ago. This takes time, but I recommend to look into how other countries are doing these things, how we are organizing the education. And I really think that the system of grants application that I have been hearing about during this AccelEd project and what I'm hearing about here is a really terrible threshold for the development of nursing in Kazakhstan. I really think the first thing that needs to be done is to stop with this grant application system and adopt another system to provide education to nurses in a broader sense, to serve the to serve the needs of this community and serve the needs of the Kazakhstan people. That's just my comment. Thank you.
Коллеги, здесь я хотела представить слово наш.
Dear colleagues, I would like to give the floor to the representatives of medical universities and colleges, Markulov Borzhan, Karaganda Medical University. First, I would like to tell about the legislative documents in the field of nursing within the framework of our PhD thesis. We've studied the legislative documents of the healthcare, and the competences of nurses are not correctly specified. There is a disorder in the normative documents. Number two, we should decide on the nurses with a bachelor degree, how they should continue their career. Because nothing is said about academic bachelor degree. Number three, let's go back to the sustainability of our project. Within the framework of our working packages, we've opened a repository at our university in Karaganda, and we think that all the master and PhD and bachelor thesis will be stored there. And we would like to ask the Department of Human Resources and the Ministry to make a kind of an order for the colleges, to oblige the colleges to store their thesis of their students in this repository. Another working package is that we've opened the GBI Center. Thanks to AccelEd, we worked with the Academy of ABU. We have the trained group, and we have to provide evidence base to students. Usually this is in paper, but we would like our affiliated group to train the teachers of colleges in GBI evidence base. When researchers work in clinical practice, so jointly with clinicists, and our colleagues work for free, can you allocate funds for their services, for the training to be carried out, and in general? Within the framework of the work package 4, we developed methodological recommendations for the quality assessment of master and PhD dissertations assessment. These documents also should be approved by the ministry, so that all the universities and clinics could use these documents in universities. Thank you. In the nursing concept draft, a lot is said about nursing science and research. To introduce this, as yesterday Johanna mentioned, we need collaboration between clinical practice and universities, colleges, so that the quality of services could be improved. So that's why I would like to urge you not to split between the applied bachelor degree, academic bachelor degree, and college. We have a lot of capacity in high quality nursing. We've learned a lot within this project. And we can teach you. We had the experience in service design, and the experience shows that the results of this survey show how practical clinical practice can solve the issue. You know how to do this, and the methodology is our strength. Thank you. Collaboration will solve a lot of issues. Hello, dear colleagues. I represent the Union of Medical Colleges in Kazakhstan. We have association, so-called association, it's the Union of Medical Colleges. We have 92 medical colleges. Out of 92, 37 have the status of a higher medical college. It means that 37 medical colleges train nurses on the level of applied bachelor degree. As it was mentioned before, if we refer to the topic of this roundtable, and if we talk about sustainability of this program, of course, there is a huge need in teachers who have master degree in nursing, who have PhD degree in nurses. This is the requirement to the trainers on the level of colleges. Not less than 30 teachers, college teachers, should have the academic bachelor degree or master degree. Currently, we have graduates of Kazakh Finnish master courses working in our colleges, and those who have graduated from local universities, and taking into account the career paths the graduates select before, like 10 or 15 years ago. For them, the next level of advanced training was to be trained as a general practitioner. Currently, the situation is different. Yesterday, my graduate approached me and said that she graduated from the college, and now she is the Nazarbayev University academic bachelor course student. And it's great that these nurses grow in this vertical line of nursing education. As for applied bachelor degree, here the critical thinking, research skills are actually provided to the students.
On evidence-based nursing, all those research carried out by our applied bachelor course are mainly of practical focused. And as of the number of students who further continue education next levels, witnesses that the demand in education on the level of applied bachelor is high. On the accelerated training program, if for the 3.5 years we train the applied bachelors based on the 11 years of school education, and there is a second accelerated program, our nurses having 3 years of experience, I mean the practical work experience, can enter our accelerated training program for 1.5 years of education. So accordingly, if we look at the statistics, as of today, we have in Kazakhstan totally 37,000 students in nursing, applied bachelor 3.5 years 6,000 students, and for 1.5 years 7,543 students. So this numbers shows that annually the number of students increased on the level of applied bachelor, among them 15 to 20%, and the next continue their education on the next level. But the next level of education, as we discussed for 2 days, is not only Kazakhstan universities, but they also enter Russian universities. And of course, the Ministry of Public Health would like to ask you to discuss these issues on the strategical level, because as the ultimate results, which are described in training nurses, applied bachelor, academic bachelor, they have the general concept on the levels and steps. So thank you very much. So anyone else? Yes, I would like to discuss based on the practical healthcare. If our education institutions train specialists, then we have the nurses with the level of the applied bachelor, and for them we have to identify to provide jobs. So as an example, my organizations, I have 37 nurses who graduated the applied bachelor, and so we have nurses with the academic bachelor. However, in the nomenclature, in the classification of the profession, there is no gradation between academic and applied bachelor. So they are titled as the nurse of expanded practice. And similar, we include them in our companies. So there shall be difference, but there is no difference. So another question on the independent nursing practice. So we have drafted the job description functions. So, but what we have as a result, the nurses with a level of the applied bachelor on the independent appointment with the patient, they work mainly with the patient who have chronic disease. Okay, we have differentiated here. We here observe the early stage of cancer disease. Second, we have patients with diabetes. Step number 3, palliative service or department. That's our monitoring of the patient's third and fourth stage of oncological disease and other services. What is the problem? If they have a patient with a chronic disease, so mainly it's 60% of patients, they visit doctor to receive the medicines. And that's the patients who have diagnosis, they have the treatment adjusted. However, our nurses with the level of the academic bachelor and applied bachelor they're not entitled to have this, the recipes. So as a result, we want to reduce the workload of the doctor, but on the other hand, we cannot do this. So another question to the colleagues of from foreign countries. So the question to you. So the patients with the chronic disease, do they entitled to have this prescription medication form? I know in Finland there are 12 months of education and then certification afterwards. And I would say yes, on the level of nurses shall be improved. Nurses want to have lifelong education, but when we say that maybe there will be courses, the nurses will pass these courses, and they say, okay, you'll provide us course, or we'll have the right to issue the medication forms, so the prescriptions, but it will be the additional workload. So will we have the additional payment here? So, but what the result is, we have the controlling bodies. If in the CMIS program, which everyone know, there shall be the check of the doctor before person will receive the prescription. So, in other words, the nurse is doing the check, the recording, but still we have to send to the doctor. And thus we take the time of the doctor, which the doctor can spend to the patient with certain acute diseases. So I believe if our nurses, and if there will be regulations where they are entitled, for example, to have, first of all, extra 12 or 1 year education, and then issue prescription, then I think will reduce the workload for the doctor. Because the nurse can identify if there is a need for the change of treatment. Of course, she will not take this responsibility, but if this person has chronic disease, the nurse can interpret the disease, so there are no any additional complaints, but again we send this patient to the doctor because there shall be the recording. So that's the scissors we have. So I will share my experience. And thank you very much for raising this issue. It's a very painful issue, coming back to the very beginning. First of all, we have to have the regulations. The nurses who are prepared, I mean, step by step. Not each nurse has to issue prescription. In our country, this is strictly regulated. The prescriptions and the independent appointment are done on the primary healthcare institutions by our nurses of expanded practice. However, they continue study 2 years after 4 years of studying in clinical, not leadership, not administration, but they learn 2 years the clinical MA course, studied clinical MA course, and 50% there is clinical practice. They work together with doctors, and they are entitled to have the first appointment with the patient, to do the check of the patient, and if this pathology is not in the competence of the primary healthcare nurse, then she immediately sends to the family doctor, to the general practitioner. So that's we call the nurse of the general practice, expanded practice. Recently, in clinics, we have opened the consultation, online consultation for nurse of the expanded practice on prescription issuing and use of medicines. Because very often, when our elderly people they do treatment and they take these pills, there are a lot of mistakes occur. So another issue is anesthesia and intensive therapy. In new regulation, which will be issued 1st of December, is saying that there shall be independent consultation by the nurse, according to the regulations. And in the system, it's shown that not money is brought by one person, but families bring money. So if to speak about the bachelor level, there are opportunities for our nurses to provide prescription, but as you said, first of all, there shall be check of the doctor, and then if this disease, if hypertension or diabetes, for half a year, this nurse can do the work prescription herself. But in pharmaceutical industry, it is not an expanded, let's say, range, but a bit narrow. However, it says about training, about the preferential database, and that not all the nurses are on the same level, shall and maybe, and the country doesn't need to have them on the same level, I mean the nurses. And when we understand this, when we understand the cascade competencies, not only on the education database, but in clinical, then these issues will not be that sensitive as we observe now. Another question. We're also the practical healthcare institution, and here we have the nurses from clinics. We face with the following problems. There is no regulations about the ratio of nurses towards the patients. Often we travel abroad, we see the ratio in other clinics abroad. Most our clinics have been accredited by GCI, but when we face with a justification about the number of what shall be the number of nurses towards patients, then here always we face with the problem that there is no any regulations or documents which will guide this issue. There are some regulations which say in urgency care there is a certain number of nurses, but except this department, we have another department, the hospitals. And there is a big workload on the nurses, 1 to 10 or even 1 to more, and therefore the quality of care is not that good. So therefore we'd like to have some regulations where will be specified what shall be the number of the nurses and to what number of patients. I mean the ratio between this. So that's the problem. So that's what we call about the hospitals. Yes. I would like to add here, I support that's important now to identify the needs of the nurses and different profiles. We understand that shall be more nurses, but here we discussed another issues and sometimes we forgot it. Now every chief doctor thinks that his doctor is very busy and how to delegate to the nurses, but no one thinks where the nurse can delegate her functions, because she shall not be the lady bring and take it back, bring coffee and take it back. So if to take the global practice best experience and we observe the trend of transition, value-based care, so the care based on value, and then the basis here is the team of experts, and it's not about doctors and nurses, but another assistants, we call them assistants. So the doctor assistant, the nurse assistant. If we speak about numbers, then in the UK system, healthcare system, it's about 32% of all employees. I think 12% is administrative staff, 32% the assistants of the doctors and assistants of the nurses. If we speak about the need, then let's be honest, so that the nurse can professionally work, do her duties, job descriptions, then she shall delegate some of her auxiliary functions to the assistants, and then we shall not be based on the regulations. Otherwise, we are limiting the autonomy of certain suppliers. We shall not only discuss about the minimum of nurses, but the auxiliary staff, let's say, secondary staff like assistants. The mentors visit our clinics, and there are some specialties like technician. In clinics, we have the nurses, and for this, in TSO, in some department, that I think there is no need to have the special nursing education for this department. Maybe it can be with the college degree, and we have to train the specialists who will work in clinic in such divisions like I've mentioned, where there is no patients and all administrative work. And also the X-ray lab specialists. I don't know whether we have at the universities this discipline, like training the X-ray laboratory specialists. And to work in the ultrasound room, you should not be the nurse. It can be the personal staff who will sit and just write down the parameters of the ultrasound survey. So, but we speak about the specialists who will work with the patients directly. Given that we have the lack of the nurses who will provide care for the patients. And of course, there are different professions, specialties, which do not require the medical education, but they are required in the clinics. And maybe to consider the issue of preparing, of training the specialists. Another issue is that in most clinics there are nurses who work as a registration office, but they shall not be the nurses, to be trained nurses to work in the registration office. I mean, to register patients to the doctors. But in our cases, the nurses, they take the position of this registration office. So I would like to add about the auxiliary staff. Last year, I visited Israel, one clinics where we had the study tour, and there are a lot of auxiliary staff, secondary staff who, like assistants, who have the carry out the duties of the nurses, and they are available in each department. So this assistants, she covers the phone calls, does the paperwork, do recording when the nurse is busy, or informs the nurse that the patient shall be taken here, taken there, so the room shall be prepared for the patient, and the nurse can do easily her procedure without answering the phone, without tackling some paperwork or the recording the information about the health or the disease. So these assistants help a lot. And we had the round table in June about the new position like medical secretary. I would like to answer this question. There we had the work of the working group about the changes amendments in the decree number 305 about the qualifications in the healthcare system. So there was a lot of terminology like medical secretary, auxiliary staff, secondary staff, but there are respective requirements which are specified and approved. Not approved, but I mean, the Ministry of Justice enacts or not. So, Ainash, can you comment on this? That you have participated as a member of the working group, and what were the outcomes of these discussions?
Hello, National Oncological Center. As for 305, or the number 305, yes, there were different issues raised with respect to introduction of positions such as auxiliary personnel. It's very hard to avoid those limitations imposed on us by the legislation. As our colleagues from clinical practice says, maybe we should introduce a resolution or order or another type of supporting legislation to introduce that auxiliary staff members in clinics. There is a need in such personnel, both the clinical registrator, call center, staff members, like cleaning staff in inpatient settings. Maybe we should raise this issue in the working group. And having this opportunity, and as it was mentioned on the applied bachelor degree, we should have a strict grading and payment for the bachelor degrees, that we have graduates with applied bachelor degree, clinical nurses, practitioners. They would like the their work to be paid on the equal basis with academic, with nurses with academic bachelor education. You know, we raise this issue often. I want to say one thing. We have graduates of applied or academic bachelor courses, and when we raise the issue of payment, that it should be based upon the competences of a specific nurse, but not for having the diploma, this like fancy diploma. No, because many of them come to the HR department and say, I have this bachelor degree, so give me the extra pay. No, grading should be introduced depending on those competences they have. This will allow those nurses to develop, and thus they will have more incentives to get higher pay. Thank you. I would like to respond. Actually, talking about applied bachelor degree, when we talk about delegating functions and we extend the competences of nurses, we cannot motivate them financially in no way. I think we should close the session. This discussion. We have a very profound discussion, and this type of discussions are needed, of course. Unfortunately, we have only half a day for this discussion, as we have to adopt the resolution. And I would like to conclude on what the colleagues have just said. As for each level of education, as another has mentioned, we're now introducing changes to the Order 305, which is the nomenclature of specialties and majors and positions. And we have a working group. And if you would like to send us a proposal on qualification requirements on each level of education in nursing, the Department of Nursing is open for this, for your proposals. Talking about the staff schedule, since last year we have introduced qualification requirements. This order regulates everything, but the regions and local authorities haven't been guided by these rules, and there is no pay for the nurses with extended practice. So this order covers the nurse with extended practice on the level of the region, of the cities of the Republican level, and districts. And the heads, the administration of healthcare facilities should actually should pay for the extended functions to the nurses. So what else? What other orders we have? There is another order on the payroll system. There is a list of positions in healthcare system, and they are split by different grades. B2 are doctors, and then college and bachelor levels of education. And the payment is made based upon the education level. We as Department of Nursing are open for you, for clinical practice, for education institutions. Please send your proposals to us. We'll discuss these proposals offline, online, no matter format and which format you select. So come to us. We are ready to take any of your recommendations. Thank you, Nazarosena, and dear colleagues, dear participants. We are closing the work of the roundtable. I would like to thank the participants who have come to this roundtable. You are the most responsible, the most mindful healthcare professionals, those people who want to develop. I would like to thank the participants, especially Nazira Husenovna, Nagul Sirikpaevna. I know how busy you are, but you found time and participated in our roundtable. You've accepted a lot of questions, and we had a lot of questions, and I think we've got some answers and learned something. I would like to thank the representatives of higher medical college, of universities, of clinics. Paola, thanks to you. And I think we had a very good discussion. You raised the questions even beyond the education frameworks. The name of our conference is the Trinity of Nursing, Clinical Practice, Research and Education. I think we've justified the name of this conference. And the universities, partners of our project, have proposed the areas of collaboration, and you should use this opportunity. And we have the center, Excellence Center for Nurses, and that center was created within the first project, ProINCO, and the question was raised where the materials can be consolidated, and we'll try to post the materials of the project on this platform, and you'll have the access to them. Now Vitaly Viktorovich, please come to the scene. He is the Vice Rector in Research of Astana Medical University. So you have the floor for a speech and for presenting the resolution. First of all, I'd like to congratulate you on the closing of this conference. That was a very fruitful conference. We've raised a lot of issues which are relevant for further development of nursing. And I would like to wish this project, though I would like to wish all of you not to stop on this. We had ProINCO project, AccelEd, and we should put further efforts into development of medical education, nurse education in particular, and there could be steps made in post-doctorate education. Certification courses are required for nurses. So there is a lot of room for perfection in research, and we can implement projects in Erasmus Plus program and within other programs. And I would like to invite you, dear nurses, to participate in researches. We have 3 competitions for research projects, for postdoctorate, on postdoctorate level for young scientists, and nurses should and can participate in such competitions. And the basis for such activity in research was given by such projects as AccelEd and Trinity. In closing this conference, let me read the resolution of this conference. We participants of the conference, out of the partners of the project on AccelEd and the level of improvement of nursing, the level of master and PhD courses, representatives of universities, research institutions, higher medical colleges, taking into account the achievements in the field of nursing in Kazakhstan and current challenges for further development of nurses, science and practice, we adopt this resolution. Consider important to recognize the importance of nurses involved on the level of practice and science to support the need of carrying out regular conferences in nursing to support development of nursing not less than once per year, to acknowledge that the results of international activities in nursing development should be applied on the strategic level and in evidence-based practice in clinical settings. Taking into account and for promotion of research in nursing and further development of nursing practice, we propose the central authorities, the Ministry of Health, Science and Higher Education, and local authorities on the level of department authorities to increase the number of the scope of state orders for the number of students in bachelor, master, and PhD levels, to ensure development of nurses in evidence-based practice, to allocate funds for research on the level of applied bachelor level in colleges and in universities, creation of a licensed nationwide journal on evidence-based nursing, and then to include it into the recognized databases of research journals, to create a repository in consortium with medical universities in higher courts of Kazakhstan to develop open science, to further develop on the level of health departments the position of a nursing coordinator, to act as a consultant and to attract high-quality specialists in nursing with a level of training on the level of master and PhD degree in nursing, to advance the knowledge of trainers and professors through study tours in particular and scholarships. The evidence-based practice development on all the levels, including expansion of the current practice and development of nursing guidelines and the consideration of training in nursing through preparation of white papers, policy briefs, and so on, strategic dialogues, creation of on the basis of the Nursing Excellence Center, to create the platform for implementation of state-owned state order for the training in nurses, to train different nursing teams, to finalize the specification of competence requirements for nurses in the nomenclature of positions and of the medical professionals, to envisage different positions for those who have applied bachelor degree and academic bachelor degree, with distinguishing between their function, to include the experts with a master and PhD degree and all in different consulting and advisory committees, boards on the level of various authorities, and into the commission which is in charge of research and science in the Ministry of Healthcare, to introduce a mechanism and professional training with mentorship in mind to maintain nurses in the profession and to support their professional development, to create a highly educated nursing workforce, to create better conditions for nursing associations, nursing communities, to show leadership in development of education, need to reconsider the staffing standards of different healthcare institutions, taking into account the new roles of nurses, introduce tariffs or update tariffs for the services of interdepartmental teams with different with nurses with different rates. The universities and high colleges of Kazakhstan are recommended to introduce the following positions, such as the following. There should be the divisions of the faculties, divisions of the nursing departments with courses on the level of master and PhD courses. They also should introduce recommendations, methodological materials, which they've gained as a result of AccelEd, to improve evidence-based nursing and provide access to all the methodological materials to all the Kazakh colleges and universities. They should also contribute to spreading evidence-based practice, to strengthen human resource capacity, they should consider the allocation of grants on the level of universities to train specialists on the master and PhD degree, to consider expenditures for research in nursing, in particular access to the text, access to the articles in English, journals in English, and so on, to create the centers for nursing, research within the on the basis of the hospitals, as it is done in Europe.
Структуре кафедр сестринского дела университетов, включая четкие пути академических,
including the precise ways of academic career in the education of nursing education, to have a separate department on nursing research in journals which are published by the universities, and regular publishing articles as a result of the nursing research. Develop the practice of nursing education and use of the justified approach to improve and update the program, the curricula for nursing education. ensure the preparedness of the work in multidisciplinary team based on the capacity which was created by AccelEd project to develop the relations and cooperation in joint research. So quite a lot of recommendations, distinguished colleagues. And I believe all of these recommendations are very important. And if they will be implemented, then our nursing service will be developed in a new form, and will be able to achieve good results. So the impact will be, first of all, in better quality of services, accessibility of services. So if you don't mind, that's all from my side. Given the resolution we have read earlier, the final words, we would like to invite the coordinator of the project AccelEd, Jurata Maciaskina, for the final comments on this project.
Yes, I will switch to English if you allow me to do that. First of all, thank you for being with us. I don't know how to thank you, actually, all of you. Starting, if now it's time to speak about the project and how it came to be alive. To start with the proposal, with the previous projects and with the previous efforts which were done in the country to strengthen nursing. I think there are many things we know what was done, but there are very many unseen and unrecognized heroes in nursing area who made that nursing became on the agenda of the ministries, on the World Health Bank, and in other projects. So all who are involved in nursing contributed to the success of many projects, AccelEd including. So thank you for doing that. Thank you for those who were preparing the proposal. Thank you for those who being with us during first phase. There were changes. People, started the project. They were replaced by others. But we called ourselves like Dream Team, implementing the activities. But without those who participated in our activities, the project will not be such success. We were calculating how many participants we did have in our meetings, trainings, other events. And we succeeded with higher numbers than we planned. And that was a great pleasure for us, but gratitude to you, because you participated in these activities and made these numbers. So thank you very, very much. Yes. And also, I was so happy about the discussions we had during these days. The questions, during first day, today, and what I realized that it's very important, and maybe we will add to our resolution one point. It's there, but still needs to be highlighted. It's about the partnership and everyone, social partners, stakeholders being involved in the process. Like very first day, I made a note for myself when it was request, please send more master degree students to healthcare institutions for clinical placements. But that's demonstrate that the healthcare institutions, universities, colleges, ministries, everyone should be together and to create nursing field. Today, you know, listening to the discussions, it was so familiar that when we have the conferences, we speak so much about the practice because it's extremely important. We might create the policy, the documents, the research programs, but you know, what about clinical practice? How about those who are working, you know, daily routine, daily clinical practice? Because I think the aim is patient and evidence-based nursing. So our networking, sometimes when we talking about networking, it's like, you know, among academia, institutions, but I see that all of us should be involved and to create all levels, speaking about nursing profession, speaking about education, and only making this beautiful carpet, you know, and interwoven everyone who is there, we will make very beautiful picture with the bright future of nursing in Kazakhstan. Thank you very much.
Уважаемые коллеги,
So, distinguished colleagues, so this is the end of the conference. The resolution has been read out, the program is implemented, and we'd like to wish the successful work to all of you for the benefit, for the sake of developing nursing in active collaboration with our foreign colleagues. Thank you very much to our academic partners who within these years participated in the project, helped to implement it, and all the colleagues, participants of this project represented by Kazakhstani universities. Would like to wish strength and enhancing this collaboration and cooperation, and a lot shall be done for the development of nursery. And the most important is that we shall have this positive willingness and aim to develop in the framework of conference and resolution. These issues will be specified. And success to all. We don't say goodbye. We hope that we'll have not one project but many, and possibilities to meet in the framework of conference and other meetings. I believe most of you have become friends within these 2 days, and this friendship and cooperation will continue. Thank you.